Listening is very important. A great doctor will listen, and many times we can diagnose much of what's going on with the patient by just listening to their history. Every day you hear of people suffering from sciatica, right? It's my sciatic nerve. A freshly herniated disc will emit chemicals that actually are irritants, severe irritants that can give extreme pain. We're trying to create space between the herniation and the involved nerve root that's causing that sciatica.
What are you doing or what are you looking at that others are missing?
Machines to get people back to functioning. That's what I've involved in my clinic so that they can think about what's really important: their family, their life, their relationships, not the darn pain that they have to deal with. You know, it slows you down. It makes life miserable.
With me today, I have Dr. Ivan Bracek. He is a clinical director at Novare Medical and Wellness with over 30 years of experience with musculoskeletal health and wellness. He specializes in the connection between your bones, brains, muscles, and nervous system. He leads a multidisciplinary team that helps patients restore strength, balance, vitality through advanced diagnostic, regenerative therapies, and FDA-cleared technologies. As the only clinic in Southwest Florida offering MRI-backed muscle and joint regeneration, his team empowers patients to look, feel, and age powerfully. Welcome.
Thank you. I'll make a slight correction.
Yeah.
We are the first to do the MRI back technology. Others have now joined into the arena. But
Okay.
We were the first clinic to bring many of these devices into our clinic to help with the restorative process. But thank you for that gracious introduction, and I'm delighted to be here.
Before we get into what you do now, kind of take me back to yourself. I know that you were in a car accident. So like what happened and like actually how bad was it?
It was pretty bad. We're talking close to 40 years ago. I was in a friend's car, a 911 Porsche convertible, and we were going through like an S curve, and we were doing about 85, and he lost control. The car went sideways. It actually hit a curb and flipped, and it was like in a moment's notice. Joshua, I had never experienced anything like that, but regardless, I wound up having some serious injuries. The car flipped over. It was a convertible. The convertible top hit the back of my head, lacerated my head, and I lost 1.5 pints of blood. The fuel cell, which is on the passenger side on a 911, ruptured, and I was doused in gasoline. I was trapped inside. A gentleman came, a yard worker came to help me out of the car. This is what I was told, and he had a cigarette in his mouth. My friend was able to jump out of the car and push that guy out of the way and pull me out of the vehicle. I could not move. I had actually fractured T9. We later found out a thoracic bone in between the shoulder blades. Fractured that bone, suffered this head wound. I was in and out of consciousness. Regardless, they took me to the hospital, and I had months of rehab. At the time, I was considering becoming a mechanical engineer. I come from a family of mechanical engineers. My father was a mechanical engineer at the time. My brother and my brother's son is now a mechanical engineer. And that was my passion because I've always worked with engines and building boats and anything, everything that had to do with anything mechanical. That's what I did. That accident changed my life. And it changed my path in life, Joshua, because I was really hell-bent on being a mechanical engineer. And part of that was, the heritage of my family and what I loved tinkering. But through the therapeutic journey of getting back to moving again and using my left leg was a real problem. My left arm was a real problem from that injury because I herniated 4 discs in that neck region of mine, the cervical spine.
And what was the big problem? What was that experience? What was like you said, it was a big problem. Were you limping or?
Oh yeah, limping. Well, sitting on the toilet, pardon me, but just sitting on the toilet, my entire left leg would go numb. Sitting for any period of time, my left leg would go numb and my left arm. And it was the weirdest thing. It would come from the neck and go down. At that time, 40 years ago, you need surgery. That's what they said, and I was very scared about that. A friend of mine, took me to a chiropractor. I had no idea what a chiropractor was, and I was scared. I thought, I heard they're quacks, and that's because that's what you heard. Within a month's time, this guy got me feeling great. And it was at that time that I realized, this guy's a mechanic, but he's a mechanic of the most amazing machine on the planet, and that's the human body. And so it changed the course of my career because I decided I want to be a chiropractor. I'm using my hands. I'm able to diagnose, or he was able to diagnose, and I want to do what he does. I mean, they wanted to cut me open, and this guy, using his hands and some knowledge and some good diagnostics, was able to get my life going in the right direction. So I completely changed and altered my trajectory of my career. And that's when I decided to become a chiropractor.
Wow, that's really impressive.
You took me back to a bad time, to be
No,
honest with you. It was a very painful time,
I can only imagine. Yeah, I mean, like the
very scary time
yeah,
in a
that's a
young man's
huge.
life. Yeah.
That's huge. I mean, like and like you said, you were unconscious. You had no idea what was
Just
going.
about. I was
about.
floating in and out. And when I
Okay.
went to move, I couldn't move my body.
Okay. So you built a successful practice in Chicago. You were there for like 25 years,
Correct.
and then you moved to Florida. Yeah. What made you walk away from the work that you were doing and plant yourself in Florida?
Well, in reality, I went to Chicago after meeting a woman and decided to get married. And we decided to have a child. And lo and behold, instead of one child, we wound up with identical triplet boys. And it was quite a miracle to have three boys that were born all healthy and normal. It was just amazing. And yet, the marriage actually went south, and I could not abandon my sons. I stayed there and I helped raise them, and my mother actually moved in with me to help me raise the boys. And actually, at the time, prior to going to Chicago, I was in St. Petersburg. I was in Sarasota. I was a Florida boy. And so I stayed there because of my sons. I had a practice that I was building, and it was very successful. And at the time of the boys graduating college, they were like, "Dad, it's you've always wanted to go back to Florida." And I was like, "Gosh, why didn't I think about this sooner?" In any event, my now wife and we decided to move to Florida, and we came here. It's now 6.5 years, and we settled in Fort Myers because my sister's here, and my mother, who's 93, is here. So that's why we chose this area.
No, that's amazing. That's
Yeah.
amazing. Yeah. So you kind of mentioned you have identical triplet boys, which is honestly wild. I can't imagine what that's like, parenting and like raising kids in that way, but it sounds like you had your mother with you as well. That helps. And that's huge. My sisters I have 9 nieces and nephews now.
Wow.
And like my mom is just the right hand to everybody there and is a huge support. So how has being a father shaped the way that you treat patients?
That's a great question, because compassion is very important. Listening is very important. And I try, it's not easy, but as a parent, you try to listen to what the kids are saying and try to coach them in the right direction. That's also helped me be a very good listener to my patients, because quite frankly, a great doctor will listen, and many times we can diagnose much of what's going on with the patient by just listening to their history, listening to what's occurred in the past. What are they feeling? What is changing during their day? What is it that they do for work? That's where the mechanic in me comes back. The mechanic that says, what's this person doing biomechanically that's affecting them? And when I put all that together, listening and being compassionate, and then using the knowledge of my mechanical background, we tend to hit a home run.
What do you think is like one of the biggest misconceptions about chiropractic care, just in general?
That's a great question. What's really interesting is that the word chiropractic comes by movement by the use of hands. That's how it originated in 1895, when the first chiropractic adjustment occurred in Davenport, Iowa. Chiropractic has evolved to involve so many different techniques, meaning the way a doctor works with a patient, whether it's still using their hands or using instrumentation or various tools or special tables or special diagnostics or special machines to help create movement of a bone. And so patients can be thinking that the chiropractor that they saw that one time that may or may not have helped them is the same kind of chiropractic that they're going to see everywhere else, and that's not true. There's really over a dozen major techniques that involve special tables, special hand tools, special positioning of the hand, and sometimes other machines to help patients get better or for the chiropractor to do his or her job. But it's not all the same. And there's so many different techniques that what works for one person may not work for another. And so sometimes patients say, I went to the chiropractor and it didn't do anything for me. So now they're jaded by thinking that chiropractic doesn't work. Whereas in reality, they haven't really experienced all the different methods and perhaps found the one that's right for them.
Yeah, that's really interesting. I've had a lot of years with chiropractors, and I have noticed a lot of different types of treatment. Is there one that specializes with like car accidents, for instance? Because you had a car accident yourself and you got better by that. Is there a certain type of chiropractic that you see that really helps people in those situations?
That's a great question. There's when you look at the biomechanical energy or the biomechanical changes that occur in an accident. Is it a front end accident? Is it a rear end accident? Is it a side impact accident? Is it a rollover? That's when the doctor's responsibility is to properly diagnose what occurred to that person. Number one, diagnostics. I will never work on a car accident patient without first taking x-rays. To me, it's important so that I know what kind of architecture that I'm working with. And for me, it's very important that I know what got injured. Is it safe to work on this patient? I say that because some patients they may be 35 years of age, and they may look healthy as a horse, and they can have a broken vertebra. They can have a dislocated segment that if a chiropractor does his normal technique, it's going to cause an issue. So with injury work, I think it's important that the doctor assesses the patient properly and then starts a slow process. And we typically start with therapeutics, physiotherapeutics. Maybe it's muscle work, maybe it's joint work. We slowly integrate into moving bones, but moving them with respect, with proper angles, and listening to the patient. And let's see how they're doing each and every visit to make sure that we're on the right path and that we haven't missed anything.
Yeah, I really got that you're paying attention to a lot of the nuances that come about when, especially in a car accident, where there's a lot of factors that can come into play. Do you send out for the X-rays, or is it in house, or how does that work for you?
I'm a tech. I have a lot of tech in my office, and I've always had X-ray. I've learned from some very good chiropractors when I first got out of school. I sought out who were the big players, meaning who were the guys that everybody looked up to, and that's what I realize is the ones that we looked up to had the good x-ray equipment. They had invested in that. They've invested in good therapeutic equipment. And so in my office, in every office that I've ever had, I've purchased probably 8 x-ray machines. And these are very important parts of the diagnostic process. We always have x-ray when a patient comes in for their first initial consultation visit and exam. X-rays are a must. And I've had situations where a patient has been injured. They've come to me and they wanted me to work on them. They'd said, please just snap my neck or snap my back. And because I've decided I won't do this until I take an x-ray, it has saved both of us. It has saved us, Joshua, because I've had injured patients that have come in from a car accident. I've taken an x-ray, and because of the training that I've had, I found something there that didn't look right. And then so I send them immediately for an MRI. And in the MRI, we were able to see that they had metastatic carcinoma.
And what is that?
That's cancer. It's cancer coming from another area. It may have been lung cancer that metastasized to the spine. And so had I just gone ahead and started working on that patient without doing the diagnostics and let that go 2 months, 4 months, 6 months, the outcome would have been very bad. And I've been very fortunate to have found metastatic disease in patients or slow growing tumors that I can then refer the patient out immediately to the right provider so that the proper care can be initiated to save this person's life.
Hmm.
And I thank my lucky stars for that, because I've had many patients come back and point to me and say, this guy saved my life. And that's a great feeling.
That's amazing. It seems what I really got is like you're more holistic in a lot of your approach than and I don't want to put down any other chiropractors or anything else like that, but you definitely take the investment is what I'm really seeing in the doing your due diligence, and it pays off in many other ways for people to discover more about their bodies and what's going on. I mean, I think a lot of people, when they think chiropractor, is that you go in and you get cracked in 5 minutes and then you're out the door, and it's like this one little tune-up. What actually happens? Like you kind of went over a little bit, but what happens in your clinic? Like, what's your process from beginning to end?
So it depends on the type of injury. So let's say that somebody was playing soccer, playing whatever sport, and they took a fall, they took an injury. I'm going to take a good history, look at their past medical history, take that into consideration, because we need to also evaluate, did they have other conditions that occurred when they were younger that might be, manifesting once again. Then we will use imaging of the region that is affected in the injury to determine what's going on and look at the quality of the joints, the segments, make sure the alignment's right. And then we begin with probably some muscle work to initiate movement and to make sure that everything's moving full range of motion without too much pain. And then we'll begin to start moving, whether it's the pelvis, the thoracic spine, the cervical spine, whether it's a hip, a knee, an ankle. I've been trained in all these different extremity courses. I've been trained in various techniques. So I also use probably about 8 different techniques depending on the individual case. When you look at a car accident, we have to be respectful, as I mentioned earlier. A car accident occurs in about 300 thousandths of a second. So in less than a third of a second, the impact occurs. If somebody looks in their rearview mirror and they see it happening, when that impact happens and they try to tighten up, the human body requires approximately 400 thousandths of a second for it to react and tighten up. So the accident's already happened. Now, what happens in an accident? Let's say it's a rear end collision or a side impact collision. The body goes through its full range of motion, but then it goes into what's called a paraphysiological space of the joints. It goes beyond that, and it'll actually sprain the joint. What's very interesting is that sprained ligaments, which are the structures that hold bones together, they never heal. They never, ever heal. And I think that's very important for people to understand. They will remodel with substandard tissue. They will come to a point of maximum medical improvement, but it's never the same as a uninjured ligament. And that's important to diagnose, and more importantly, to document. So early on, my diagnosis procedure is going to be in depth. We're going to look at, I want to see photos of that accident. I want to see what kind of property damage. And it's interesting because certain accidents with certain vehicles will result in a much lower level of severity of injury than other vehicles in the same exact accident. And it's because of plastic deformation, which occurs in the vehicle itself. The
What
car,
did you call it?
plastic deformation.
Okay.
And it's a term that has to do with like the crumpling of the metal of the vehicle. Engines are designed in certain vehicles that are high end to drop down out of the way when a car gets compressed, so that that engine doesn't come back and possibly cause a fatality that could have been avoided. When you look at your higher end cars, they sacrifice so many vehicles in crash tests. And why do they do that? For the safety. That's why people seek out Porsche, Mercedes-Benz. Those are great vehicles. They are designed for that. And many other car manufacturers will buy those vehicles, crash them and determine how can we make our vehicles better by respecting, Dr. Porsche's work that he did. Mercedes. Look at what those vehicles have brought to the world. People walking away from accidents, that most people would say, "My gosh, somebody had to die in that." So the diagnostic procedure is something that takes time. My initial visit for a car accident case or a serious injury, the patient's probably going to be here an hour and a half, possibly 2 hours, because I don't take this lightly. And it all stems from that accident that I had, almost 40 years ago that almost took my life. At that time, nobody did this kind of stuff. They're like, he's alive. We stitched him up. He's got a broken bone. He needs surgery. Nobody looked at all the other factors that came into play. The brain injury that occurred from me hitting my head so hard. There's a lot that goes into diagnosing an auto accident case, a fall from a building, a fall that occurs, or somebody having a sporting injury where they take a hard hit. A lot that goes on, and we don't have enough time to go through all of that.
No, but it's fascinating. And what I'm kind of hearing, and I want to touch base on it because I was going to ask a few other questions along this line, but I think it's something relevant, is that I'm seeing, as I go and see my primary care, I'm seeing I'm hearing from them as well, like in the privacy, that they're just getting less and less time with their patients. They're going in, they're seeing this chart, and then they're saying a bunch of stuff. It's very prescription style medicine, and it's out the door, and they're on to the next one. And I've had several doctor friends of mine that have like become disillusioned in that. They've actually left that side of the business to start their own like concierge types services where they became more holistic in their practice. But I'm also hearing in yours is that and I'm kind of seeing this now, is that like chiropractic is becoming a holistic form. It's that doctor that we used to have, probably, 100 years ago, that would actually pay attention and spend time and really get to know everything as much as the information they had. So I just wanted to touch base on that I'm really just acknowledging that I'm seeing like 1 to 2 hours first time visiting a patient. I couldn't imagine a doctor spending that amount of time with their to get to really know what the root cause was.
Thank you for that. Much of what you're talking about occurs because of sick care or healthcare insurance. And that's because the doctor is going to be paid by the insurance company a certain fee for his evaluation, and that's it. And it's a numbers game. They need to see more people in less amount of time. Most of the time, the doctor will see the patient for about 3 minutes, 5 minutes tops. That's not the case with me. It can't be. It's just not the way I run it. And yes, we don't make as much money as some of these big clinics, but the care level that people get, if you look at, I haven't looked, but I've heard that we've had great reviews because of the time I spend with patients and the care that we give. At most physicians' offices, you've got an MA that's going to spend most of the time with the patient. Sometimes it's a nurse practitioner, which is great, but it's very rare that patients spend quality time with the actual physician because they just don't have the time. They have to be running from room to room to room to see patients. And what's really interesting also is that traditionally patients have been expecting a prescription because why? We see that on television. You've got this ailment. All of a sudden, these people are playing ball and they're having a great life because this prescription has brought them to that level. They can enjoy life again. The reality is, no, that's not what's going on. These prescriptions are actually changing their life, and maybe it's helping to some degree, but what about these side effects? So when you talk about the concierge lifestyle that so many physicians are going to because they've gotten sick and tired of that, many providers, and I have friends that are medical doctors, they've gone to that concierge model, and I applaud them at that. They said, you know what, we're not doing this anymore. We're going to have a membership fee that patients pay, and they get to call. They've got my cell number, and they get to see me whenever they need to. And that's really where many doctors are going towards, because they're realizing, many of the younger doctors that are coming right out of school, they're doing their time, they're at their ERs and such, and they're like, I don't want this anymore. I want to have a practice that rewards me emotionally and spiritually, that I'm helping people as far as their life is going, as compared to just writing a script and here you go, Joe. I got to go. Nice talking to you. So the concierge lifestyle is because more and more people are wanting and expecting more. And so many chiropractors have gotten into that. They're big into nutrition. They're big into testing. They're looking at bioidentical hormones. They're looking at various ways of boosting somebody's immune system naturally. And that's something that we're getting into also, so that we can have a well-rounded approach at keeping people healthy without medications, without surgeries unless they're necessary. And believe you me that I will send patients for the proper diagnostics or send them to the right physician when I think it's necessary. And many times, especially in big injury cases, or most injury cases, I want that patient to visit an orthopedist. I want them to visit a spine specialist. I want them to see if we need be an interventional pain doctor, because there's a lot that we can work together as a team for that patient to help diagnose their problem, help get them the proper care, manage their recovery. And in my case, it's all about documentation. If we don't document that, that patient is going to have a tough time closing out their case. Whoever, all the documentation needs to be spot on to make sure that we're showing where the patient came in at and where they finally wound up at when they reach maximum medical improvement.
Yeah, tell me a little bit about that, the documentation, because I know that's a really big part of your practice here. But what's the like? Why is it important? Why should somebody care when they get into a car accident? And particularly, like you said, you might like you have to interface with lawyers, I imagine, too, on this. So kind of just enlighten me a little bit around that.
So let's take my accident. Horrible accident. We actually hit a palm tree and it was thrusted 100 feet away from the accident. And it was a palm tree this big. I don't know
Oh,
what they call them, sago palms or something really big, fat palm tree. The documentation was, young man involved in a car accident, rollover car accident, laceration, fractured thoracic vertebra, suspected herniated discs in the cervical lumbar spine. That's it. There's nothing that was documented as far as method of impact, nothing like that. Now, this was a loss of control accident, but when people are involved in, let's say, two-car accident, people are going to be expecting to get the right care. Attorneys that represent the patient want to make sure that the physician that's treating their patient is hopefully going to document everything appropriately so that it makes his or her job easier to say, this is what happened to my client. These are the injuries that they're left with. And that part of the business is a part that I don't get involved in, because mine is helping the patient, diagnosing the condition, treating the condition, and diagnosing how they are at maximum medical improvement, which is the point in time at which it's not expected that that patient's condition will change markedly within 1 year. So that's a very important aspect. And so when I document an injury, were you stopped at a stoplight? Did you have your seat belt on? Were airbags deployed? Side airbags? Did you strike your knee on the dashboard? Did you hit your head on the side window? Did you hit your head on the A pillar or the B pillar? The A pillar is the windscreen is the front windshield. The A pillar is that piece of metal that goes from the windshield to your driver's side door, and the same thing on the passenger side. The B pillar is the one on your side here. The C pillar is back behind you. These are all structures that I learned when I went through accident reconstruction cases training, so that I could help document what happens to a patient. I also am a certified independent chiropractic examiner. So when I do a final report on a patient, I'm able to look at that documentation that I've taken throughout the course of care, and I can actually do what's called an impairment rating. Sometimes it's necessary, most times it's not. It really depends on each and every case. But having the training to do that is very important, because the documentation of a car accident injury is very important. Even a small rear ender that has very little damage to the vehicle, many times has more structural damage to the patient than one where the whole trunk was demolished. And why is that? Remember earlier I said plastic deformation? That crumpling zone happens over a period of time. So that trunk that gets crushed in is slowing down the impact from that whiplash accident, as opposed to you're just sitting there and your car gets popped from behind to where something called the core support, which is behind the bumper that, I know I'm talking about goofy stuff. The core support holds the bumper and the outside structure in, and it's designed to collapse. Many times a bumper looks perfect, but those core supports have collapsed, and that energy went right into the car and whipped that patient's head back without any significant damage to the substructure behind the core support. So what this has to do with the amount of time of acceleration, deceleration injuries. The whiplash accident can have profound impact on the patient's long-term health. I'm talking about 10 years, 20 years, 30 years down the line. This is something that I've had patients that come in, Joshua, they come in for neck pain. I've got neck and upper back pain. I don't know what's going on, doc. Did you have an accident recently? No. What's going on? I don't know. It's just been past few months. It's been getting worse. I'm starting to get numbness and tingling in my fingers. Traditional chiropractor will just take them in, crack their neck, as you said earlier, send them on their way. I'm going to take this history about that patient's past medical history, past health history. I'm going to say, are you sure you've never been in an accident? No, I haven't. 20 years? I can't remember. Then we go back and we take the x-rays. I take into account what is that patient's spine supposed to look, a 35-year-old, a 45-year-old person. There's kind of like a range of how much arthritis they should have in their neck. I go in there and I look at certain structures. All of a sudden, I see this x-ray light up with a bunch of arthritis. I go, this is not normal. And it's usually going to be in what's called the stress vertebra area. So like the C5, C6 area is what actually holds the most load in the cervical spine. C5 and 6, which is in the middle neck or lower portion of the neck, that area is responsible for accepting a tremendous amount of whiplash in a spine. Why? You've got this 8 to 12 pound bowling ball on the top of your neck that gets whipped all the way back and then whips forward. After an accident, it'll normally take about 5 or 10 years for you to start seeing arthritis growing in that neck. So I'll ask the patient again, I'll say, listen, Joe, this isn't normal. Look at this. This is a healthy spine. Look at this. He's like, whoa. Now that you say it, when I was a kid in our station wagon, we got really whacked from behind. So now it comes about that this patient has a pre-existing condition. So let's say Joe is now, we're done working with him, and then he goes home and he's sitting at a traffic light and he gets ripped from behind again. He gets hit from behind. That area is going to be more susceptible to re-injury because it's already a mess. And so that's where documentation comes in. The doctor needs to have a clear history, past medical history of that patient so that he can say, Joe has a past medical history of an accident. Well, sometimes people say, well, you don't want that. Well, yes, because it's important. We now have an aggravation of a pre-existing condition. This is huge because this marks that Joe's going to have issues down the line. I will put that in my report. What the attorneys do with it is their business. That's why patients hire attorneys to help represent them, because these things get worse and worse and worse. Just like the football player that you see hobbling around because he had so many knee injuries. That's arthritis, even though in his 20s, he's like, I'm an athlete, I can handle it. When he's 50, he can't. It's biophysics. It's what's going on with degenerative conditions, injury, traumatic load, a lot of different things.
No, yeah, I could see a lot of different things going on there. There's this statistic that I keep on seeing and it's particularly like in Florida for Florida residents, I imagine. And that's it. You have 14 days after a car accident and you need to see a doctor. And if you don't, that you lose your health benefits completely is how I understand it. Now, first, is that true? And what do people most get wrong about it?
Great question. There is a statute that says that you must see a medical doctor within 14 days. Pardon me, you must seek care within 14 days of an accident. That's number one. And you must have what's called an emergency medical condition evaluation to determine if those injuries that you sustained warrant therapy. Why? Because here in Florida, it's a no-fault state. So when people are involved in an accident, it's important that they get evaluated right away. Now, sometimes patients will say, you know what, it wasn't that big of an accident, I'm going to let it go. If they wait over 2 weeks and don't see a doctor, their PIP insurance, personal injury protection, which all of us have if we have auto insurance, it's part of the Florida law at the current time, that insurance comes with $10,000 of personal injury protection, which means it's $10,000 worth of medical care. That means that a patient can go to a doctor of their choice, and the doctor who knows how to document and build the insurance needs to submit a claim and inform the insurance company, and the patient needs to tell their insurance that they got in an accident. There's $10,000 worth of coverage. If they don't go within the 14 days, that $10,000 gets capped off at $2,500. And I think it's a good law because what it does is it prevents people from waiting too long when they're hurt. Hopefully they'll know that, but it also reduces the amount of fraudulent claims. Somebody saying, oh, it's a month now and I want to go see the doctor for this accident. No, you can't do that. If you were hurt, you sought out care. That's number one. When you're hurt, you need to seek care. The doctor will then have, if it's a chiropractor, he will get the medical affiliate to create a emergency medical condition evaluation to determine if that patient qualifies for the care related to that injury. So it really is a great way of limiting fraud in the state of Florida. And it's also hopefully a good way to encourage patients to seek care after an accident because it's important. Even those small accidents, as I mentioned, can have longstanding results.
Yeah, I can really see that long. I think of for anybody that's listening or anybody that's, a part of, thinking of this thing, it's like sometimes these injuries, they, like you said, they show up much later in life. So like it's important to think about the longevity, not just like the immediate. I may not be in as much pain. Maybe I can turn my neck a little bit more, or a little less than I normally can, but like I'm not going to go see anybody. It'll just heal itself versus there might be an actually serious underlying condition. And so what I'm hearing is like you would highly recommend somebody get care, and obviously they can go to chiropractic care like yourself as well as doctors, I imagine.
Sure.
Is there anybody that they can't go see that would not be qualified for this?
Yeah, they can't go to their massage therapist.
Okay.
They can't go to an acupuncturist. They need to be evaluated by a medical doctor, a chiropractor. They actually, if they can go see a dentist, that would qualify because many times people will have TMJ dysfunction, the temporomandibular joint dysfunction, due to the whiplash mechanism of injury. And many times they'll start getting headaches and it'll be related to jaw pain because of the way their head was at the time of impact. Dentists can qualify to see the patient, orthopedic surgeons, all different subspecialties, internal medicine doctors. The thing is, what's really interesting is that most of your primary care physicians, they don't deal with auto accidents. They don't, because the insurance will not pay for that. They deal with health insurance, and they don't have the expertise in billing personal injury cases because it's a totally different method. It has a total different set of rules, standards that need to be met, and qualifications I feel that are important. But a good chiropractor, one that documents your case thoroughly, that's what's super important because we need to make sure we're checking out all the boxes and checking them off and we're not missing something. Diagnostics is very important, and MRI evaluations need to be performed in a timely manner if the injury's warranted. That's what's really important. So it depends on good diagnostics, good evaluation techniques.
So one of your patients, he's a dentist. He came in with back pain. Now, other providers had missed something. Walk me through that diagnosis and what was actually going on.
So every day you hear of people suffering from sciatica, right? It's my sciatic nerve. There's only two real causes of sciatica. It's either something pressing on the nerve in the buttocks or the piriformis region, or it's something else constricting the nerve. A herniated disc in the lumbar spine or the lumbosacral spine, which is the very base of your spine, can put pressure on a nerve root. A freshly herniated disc will emit chemicals that actually are irritants, severe irritants that can give extreme pain, that will radiate down into the buttocks, into the posterior thigh region or the hamstring region. Many times it'll radiate down to the lateral or the middle of the calf. When it's very bad, it'll go down to the toes. Sciatica is a serious thing, but most people say it's just sciatica. It'll, do some exercises, do some stretches. Well, in the case of this particular professional, he had heard about me through another patient and friends in the Sarasota area, which is, an hour away. He had visited several other practitioners, didn't get any really great relief. We did a combo. First thing I did, sent him for an MRI. Boom, herniated disc, L5S1, pretty good size. So we started him with some therapy. We started him with decompression therapy. And so, as I'll show you later, we have these really advanced. They're the world's best decompression tables. They're literally patented now because of their technology. The University of South Florida has a program where they're doing studies. There's actually another study going on with the military, the Department of Defense, using these tables because of their effectiveness. Well, in this case, we were getting some effective treatment of his sciatica, but we were still having some issues. And so we coupled it with some other machines. We coupled it up with some energy-based machines that we have, like MRI technology. When you look at MRI machines, a really great MRI machine to evaluate the lumbar spine, which is a big area on some people, right? You got a big guy, you need a big magnet to penetrate. Typically a 3.0 Tesla, meaning 3 Tesla strength magnet to penetrate the patient to give a nice clear image. Well, in both of our offices, we have machines that have 3 Tesla magnetic coils powered by computer-based machines that create what's called high intensity focused electromagnetic pulse waves. These pulse waves actually penetrate deep to help stimulate the regeneration of tissue, to help actually build muscle, to relax muscle spasms, and to help patients gain better range of motion, better strength, reduced pain. When we couple that with our spinal decompression machines, now we're hitting a home run. Now we're getting great results. We have another machine that uses another set of pulsating technology that was actually developed for pelvic floor health. And yet we're finding, and this is because of my brain always trying new things, we took that machine, coupled it with our other magnetic machine, and we're helping people that have problems that they've had for years with sciatica that has not resolved. And it's those types of innovative searches that I try to do on a regular basis that have helped us help patients restore and regain their health, even after long-standing problems.
Yeah.
I don't know if I answered that correctly.
Well, no, we're going to touch base on. We'll go back on
Okay.
that one because you got a lot of good insight. I'm going to come back to the dentist in particular. So it was a spinal you had a decompression machine, and
Correct.
then you were using you recognized the herniated disc. I'm just kind of curious on like the specific therapies for the herniated disc that you were able to resolve. And then what's the result? Like, what was his life now after this?
Well, great question, because, when it comes down to what's his life like, the herniated disc will never completely heal by just doing decompression. All we need to do is pull enough to get that herniation to come off of the nerve. That's the main thing. I would never lie to a patient and tell them, I'm going to be able to resect that disc completely back into where it's supposed to be, and you'll never have a problem again. I've never, ever said that because it's not true. What my goal is to help you function better. Over 50% of the population over the age of 50 that are walking around that are asymptomatic, meaning they have no symptoms, are walking around with herniated discs. They don't even know it. Why? Because that disc is not causing direct pressure on a nerve root. As long as there's a little bit of space, and that's what we're trying to create. We're trying to create space between the herniation and the involved nerve root that's causing that sciatica. When we do that, and then we start strengthening the muscles that those nerves are supporting, that's where we get the real home run. And the dentist that came in from Sarasota, was getting some relief from the decompression, but then he'd get back in his car and drive an hour home. And, it was kind of like diminishing his return on his investment. So we actually coupled that with the chair. And after his first treatment with the chair, the magic chair,
Mhm.
he walked in in his flip flops. He's retired, and he comes in. He's a barreling kind of guy, strong little guy, and he's looking at me with this grin on his face. He comes up to me, he goes, "You," and he picks me up. He lifts me off the ground. He gives me a kiss on the cheek. He goes, "I don't know what you're doing, but I want to sit on that chair again," because he was getting such great results, and it was so cool to see this type of result that's happening. And it's something that I'm sharing with most of my patients. I tell them, listen, if you really want to kick this sciatica out, let's get you on the magic chair, on the Emsella.
Wow, that's
It's
amazing.
really cool.
Well, I think I would like to just know a little bit more, like this magic chair. I'm sure everybody else is going to want to know, like, what's the technology behind it? What's the secret? And like, what's it's doing? Because obviously a man barreling in and picking you up, that's not a normal, that's a great testimonial is what that is.
And that was after his first treatment. That was pretty outstanding.
Yeah, it's amazing.
So the Emsella chair is a chair manufactured by BTL Industries. It's a chair that was originally designed for pelvic floor health for females, but over the past 7 years, more and more clinical tests have shown that this device is able to help men with erectile dysfunction, men that have urinary urgency, that have challenges holding their urine throughout the night, or leakage. It's also helped assist with pelvic floor health as it relates to lubrication of a woman as she's getting older, so that relations are not as painful and the sensitivity increases. Why is all of this happening? And it's because of the energy that's going around the sacral plexus, which is that pelvic floor, the nerves that come out of the sacrum that envelop the pelvis, and then some of those nerve roots are going to the organs of reproduction, the urinary bladder, the reproductive organs, going down nerve roots, transmitting into the sciatic nerve, going through into the legs. So everything that's happening in your legs is coming from that region. You're seeing a machine that's able to push almost 3 Tesla. I believe it goes up to 3.1 Tesla, the strength. That energy is really energizing those nerves. It's making muscles fire 11,000 contractions in a 28-minute period. It's insane. And they are supramaximal contractions, meaning that you can try to do like a Kegel exercise, and you're only going to be able to fire that muscle at approximately 60% of its potential. The machine can fire at 100% involuntary muscle contractions, but they're at full action potentials. And the scientists at the company at BTL have determined what's the best firing rate, what's the rest needed, fire it again, rest needed, so that they can fatigue that muscle. And they're basically giving your pelvic floor a workout. You're getting a pelvic floor workout by sitting on a chair, reading a magazine, or on your iPhone for 28 minutes. That region is energizing and sustaining function of the sciatic nerve. So I actually have a patient, let's say they have a right side sciatic nerve. I've decided, let's put that patient in a relaxed position to where the magnet, because the area of focus, the therapeutic area is approximately 4.5-inch diameter region where the Tesla coil is pushing up through the pelvic floor. So instead of just working the pelvic floor, if somebody's got sciatica, I will have them switch over to that side and put that coil right over the sciatic notch and where the piriformis muscle comes through and overlays the sciatic nerve. So we'll put them on there, and it's amazing the results that we're getting with sciatica. It's truly an amazing chair. It's like nothing else.
And it's really cool because a lot of people, like myself included, think that sciatica has a, it has a certain type of treatment, right? It's a nerve issue. It's about separation. And I never think about like other tools. Like myself, I've had that sciatica where you were explaining it goes down like past my knee and it went all the way down to like just the tip of my foot. And so I remember experiencing that pain and, just candidly feeling kind of helpless about it because there wasn't anything to do. Like stretching somewhat helped, working somewhat helped, but it would just come back with a vengeance. And it really interrupted my day. And I was just living with pain, in the 4 to 5 range, it wasn't exactly ideal. So something like that is not even my awareness of somebody that's been in sports, played. And I just think that's really amazing to see. How long has that technology been around?
Before I get there, I want to ask you something. How'd that make you feel, that pain? Young?
No.
Old?
Oh, very old.
It did, didn't you?
Yeah, absolutely.
Pain is subjective, but what it does to your life, it's really amazing when people experience pain, how it basically screws with your brain. It really makes your life miserable. And it's amazing to see how technology, when used properly, can really help bring you back. Because, as you were talking about that, I'm thinking, isn't it amazing how our bodies work constantly when everything's going right? You don't feel a thing wrong. You're able to function. You're able to walk at a moment's notice. You can jump. You can move. When you play sports, you feel more alive than ever. I remember when I played soccer, those soccer players, they're gods, man. They really are. Those track stars, they're gods. We look at the Olympians. They're moving like they're angels, and here we are. When we have pain, it shuts us down. And we're sitting there looking at the Olympics. We're looking at these titans of sports. We're looking at these gladiators. We've always admired them. But when a gladiator's hurt, they'll go through any means necessary to restore their performance, their function. And that's what I've involved in my clinic, machines to get people back to functioning so that they can think about what's really important, their family, their life, their relationships, enjoying the work they do, not the darn pain that they have to deal with. It slows you down. It makes life miserable. So I just went off there. I forgot your question.
No, that's great. That's no. I think that was a perfect one in there. And I was just kind of curious about the technology. I think so I'll just rephrase the question again, specific to that is this technology, like how long has it been around? I've never even heard that it existed and it's only come into my awareness in the last few months.
I think the initial M-Cella was released in 2017 or 2018. There's BTL is a pretty amazing company. We've invested heavily in energy devices in our clinic. We have a variety of different. We have MRI.
And explain energy devices, just because I think a lot of people might think woo woo in this when I hear energy devices.
Crystals.
Yeah.
Well, actually, our lasers are effective because they're actually taking energy and electrical energy and forcing it through crystals and creating light waves or certain spectrums of light that they found to be therapeutic. So we happen to have a energy device. We happen to have a laser that focuses on the 1064 nanometer spectrum. What does that mean? It is the deepest penetrating therapeutic laser that you can get for working on patients, on animals, on all sorts of living things to help their life feel better. It decreases inflammation, increases circulation, increases range of motion. It stimulates mitochondria. Mitochondria, as pretty much everybody knows, is the powerhouse of the cell. When mitochondria is activated, healing starts, restoration of function starts. We have the world's coolest laser. And I've had so many patients that have given me testimonials recently. And quite frankly, we were the one of 4 test centers in the entire country to be granted this laser that the company said, Dr. Ivan, I wanted you to start trying some clinical trials of this laser for back pain. So we've been doing research with the laser, and every single patient is getting better with the laser. So that's a laser. Then the other energy device that we have, Joshua, is M-Sculpt Neo. We haven't even talked about that. That's a machine that until recently was mainly for aesthetics, meaning I could take that machine and put it on someone's belly and burn their fat, their abdominal fat, and tighten their muscles and create muscle contractions to the tune of 20,000 muscle contractions in 30 minutes while burning fat. Now, how does it burn fat? Well, when fat cells are brought up to a certain temperature, 42 to 43 degrees centigrade, the cell wall will lose its integrity, and it'll go through a process called apoptosis, which is the breakdown of the fat cell system. Once we do that to a region, it takes about a week for the body to naturally eliminate the byproducts of that through the lymphatic system down into the urinary and the fecal system to excrete it from the body. We do these therapies once a week, and we can actually melt fat away. But what we found was the machine, and the reason I purchased it was not for that. I purchased it because I knew they were coming out with a functional side. They were taking that same machine and they were altering the program. The physiological effect on tissue was now moving towards joints, muscle pain, and rehabilitation of tendon injuries, joint injuries, decreasing inflammation. And I said, if that's going to work, and they got clearance from the FDA. So these are FDA cleared devices that we utilize to help patients with their injuries so that they can get back to functioning properly, back to what I said earlier, loving the family, loving their job, loving their relationships with their friends and the sports and the things that they love to do. And these machines are just, they've been a godsend to our practice. They really have. And it's what's really separated us. It's brought us, in a different place when it comes to comparing us to other clinics. We're just in a different place with these machines.
I mean, I could really see that. It's like, there's chiropractic. Once again, we kind of talked about it. Like most people think of it as just a crack and leave.
Right.
And it's really like holistic here. I mean, you're really investing in the technology. I can see that really big. I have like a question. You have another one of your patients that when I was researching you,
Okay.
and she goes by the name of Magdala, and she wrote that you actually saved her life. Not in a figurative way. She literally said that you saved her life. So like what actually happened there? I'm really curious.
If it's who I'm thinking about, patient that wanted me to crack her back. She came to me because her husband called. I speak Spanish. I speak fluent Spanish, and I've advertised on Spanish radio. And they know me by Dr. Ivan. And so I'm on the radio and I'm talking about the power of chiropractic, the power of our diagnostics, our energy devices, everything that we do in the clinic, helping people. And he came to me. I remember who we're talking about now, and he said, my wife's got a lot of neck pain, and we really want to see if you can help her. So she came in. They came in together, and I was doing my evaluation, and I took an X-ray, and I knew that something was wrong. I don't adjust people's necks just casually, and I'm so glad that I didn't on this one, because she had a very large tumor in her neck, in her bone. However, luckily, it was not metastatic. So I took that X-ray. I sent her for an MRI. Number one, they said yes. This patient needs an oncological exam, sent to an oncologist, pardon me. We did that through her primary doctor, and she had surgery within, I think it was about a week. She was
Oh
on the
my
table.
gosh, that's really quick. Okay.
She had surgery, and they were able to resect the tumor. They had to do a little reconstruction, and she came back to see us. And of course, tears and hugs, and that's what keeps me going, man. That's what keeps me going.
No,
This is cool stuff. And, to me, this is where, listen, as a chiropractor, you can do whatever you decide the way you want to practice, as long as you do no harm. Number one, I like to take it a step further, and I want to make sure I really help these people, because too many times people just keep getting their neck cracked, keep getting their back cracked, and there's a lot more going on deeper that needs to be addressed. That when a doctor knows his limits, his or her limits, and thinks about the patient first, that's when we all win, really.
No, absolutely. I really got that. That's amazing. And I can only imagine how appreciative, and her husband, how appreciative of, you can't really.
Don't make me cry.
Let me ask you about this one, because you kind of touch base on a lot of this, like doing diagnostics prior to doing anything. So I heard that you require like an MRI, or it's like my understanding that you require like an MRI before spinal decompression. And I heard that other clinics don't. And so, I know that it's a one way or another. So like, why do you insist on it? I'm just really curious about like, what are you doing, or what are you looking at that others are missing?
It's funny, you just started saying that, and I'm like, how am I going to answer that one? And I was thinking, okay, let's say you take your car in for an alignment, and the guy puts it on the rack. Yeah, it looks a little out here. Why don't I just take the hammer and hit it over here? They don't do that. They put it on a four-wheel alignment machine. They're using lasers to determine how your tires are going to wear, to make sure that they're going to wear properly. You take a patient, a human body, the most amazing machine ever made, and you're going to just pull on it and say, let's see if this is going to work? Come on. If you've got an L5 S1 disc that's herniated, you need to pull it between 0 and 5 degrees of angulation on a decompression machine. If it's an L4-5 disc, you're going to pull it from 10 to 15 degrees. If it's 3-4, you're at 15 degrees, depending on your machine, depending on the disc, depending on the patient's body size. Doctors need to do no harm. In my case, I want to do the best damn job I can. And that's going to require me to have an MRI, to look at that MRI, to take my regular x-rays of the patient, to take into account their body size and style and the way they stand. When I put them on my decompression machines, Joshua, I am taking my mechanical knowledge to say, I am pulling you at 13 degrees or whatever it is based on your body size and what your MRI tells me. If I don't do that, I'm just taking your money. That's why my patients, sometimes, and that's why my patients get better quicker, I feel. And I think, so another thing that's really interesting, diagnostics are super important, because there's times that things are going on in a patient's neck that shouldn't involve decompression. There's something called a syrinx. And a syrinx is a fluid-filled region of the spinal canal. Many times it occurs because the cerebellar tonsils are protruding below the foramen magnum, inhibiting the normal cerebral spinal fluid flow that occurs. Cerebral spinal fluid, it bathes the brain, cushions it from shock. It creates a weightless environment. But that cerebral spinal fluid also goes through the entire spinal canal all the way down to your sacrum, and then it comes back up. And at any given time, your body has approximately 125 to 150 on average milliliters of cerebral spinal fluid. But what's really interesting is that the body creates about 500 a day. Where's it going? Yeah, I see the
Yeah,
look on
I'm
your
like,
face.
yeah, where does it
The
go?
the the beauty of the body is that it's constantly being replenished, and it's basically cleaning neurological waste from the neurological system. It's basically cleansing that and dumping it every day. It's happening. A syrinx can be forming in a person's cervical spine.
What's the
A
syrinx?
syrinx. It's like, and you can only see this on an MRI. My machine will not catch that. An X-ray machine will not see it. It needs a good quality MRI. And a syrinx can manifest in a variety of different symptoms. And so that's why it's so important for a doctor after the first few visits. If my patients aren't getting better within 3 or 4 visits, I send them for an MRI because it's going to give me information that's going to help me find out what's wrong with them. You know, I think when doctors use technology that's available to them, they become rock stars, man. They really are out there for their patient. It's not just about the cash, you know. Let's why Maria's not getting better. Joe's not getting better. Let's get an MRI if it's indicated clinically. If something's going on, that MRI is going to show me a lot. Diagnostics are super important. They allow me to do that decompression at the right level. They make sure that I don't have contraindications that would warrant a neurosurgical evaluation and consult with appropriate doctors so that we do the right thing for the patient. That's important to me. And I think it's important to many chiropractors, most chiropractors. And I applaud the ones that use this. And I applaud those that go out there and seek other professionals to work hand in hand with, because working with a neurosurgeon, working with an internal medicine doc, working with an orthopedic surgeon is very important. And when our patients don't improve over a period of time, we send them out for another. What am I missing? I may have missed something, but I'm always evaluating their progress to make sure we're taking care of them first. That's very important.
Yeah, that's amazing. I really got to see. I'm seeing this through line where you're really. I think your engineering background has really
Yeah.
influenced this, and you're really accepting of technology. Because I see, not to once again compare to other chiropractors, but a lot of people are just all hands all the time. But then I'm really getting to see that you're multimodal in the way that you're solving a lot of these issues.
It's different. I'm also a guy who, yeah, it's my background because, as a 18, 20-year-old kid, I would take a little car like the size of an MGB or a Ford Pinto, and I'd put a big V8 in it. In a matter of a couple of weekends, my buddy and I would roll the car upside down, build a frame for the car, um, put a whole new Ford rear end in the back, a 9-inch rear end, put a 289 V8, and we basically built rocket ships for the road, and just had fun doing that. So when I look at this human body, I'm like, what can I do to make it better? That's all it is. I got to take what's going on here. Why isn't it working? I know I can figure this out. And if I can't, I'm going to surround myself with other professionals that can, because we need to work together for this patient. So yeah, I'm all about tech. I'm a goof about that kind of stuff. But my hands, I've had, like yesterday, I had a brand new patient. Luckily, she came to me because of Google reviews. She said, I liked your reviews. I had 2 new ones, and they both said, really liked your reviews. I haven't even read them, so I don't even know what's out there. But the one got hit on a bicycle when he was 5 years old. Wow, what happened to his spine? And he came to me saying, you know what? I was under chiropractic care before and it really helped me. And I had kind of fell out of it and I'm kind of new to the area. And so I looked at your reviews and I said, you're the guy for me. And it was so cool to be able to do what I did. And he had never experienced my technique. He never had anybody stretch him out the way we do with our flexion distraction table. The second one was a young lady who moved and needed a new chiropractor. And she looked at our website and she said, yeah, well, my other doctor, he could never really get my mid back to adjust. And I tried it a totally different way, which I found to be a very comfortable way to adjust the mid back, like the region between the thoracic, the shoulder blades, that thoracic region. And when I did it, she just like lit up like, wow, what's going on. Um, and then it brings me to another patient the other day, brand new patient that I'm working on. And the guy starts crying after I adjusted him because I turned the lights on, man. He's like, no one's ever done that to me. I've been suffering like this for decades. This is what I do, man. This is what I love, getting up in the morning to do what I do. It's really cool. Do no harm. And like my father always said, if you're going to do a job, do it right or go home. And that's what I do. You're tearing up too.
I'm tearing up too. Yeah, it's really
it's an amazing.
I appreciate people
man.
that really care. It makes, like, I could really see how you're making an impact in people's lives. You're really changing, and it's changing. It's really feeding your soul, your spiritual soul on this thing.
And you know what else? I'm not getting rich at it because I'm investing in too much technology. We try something. We try new technology. And she holds my hand and she says, honey, there's people suffering that need this. And we buy it. And then eventually, and we know that the universe, God will bring us people that need help, and we're here to help them. And we're here to try our damnedest to get them better. And if we can't help them, we're going to find somebody who can. That's what it comes down to, Joshua.
Yeah, really got your commitment to that. That's amazing.
It's cool. I'm older, but I'm just getting started, man. This is cool. We're rocking.
That's amazing. There's one thing that I wanted to touch base. I'm gonna skip that question because I think, I'll ask it just because I'm curious. Because you told me that you had like a $25,000 chiropractic table. I was like, I don't understand. It's just a bunch of padding and metal.
Sure.
Why is it $25,000? What makes one chiropractic table better or different than another one?
Well, that's a great question because number one, the chiropractor is the most important part of the equation. But the table that I use is called the Ultimate Table. And I've been using these tables from this company for 30 years. Pardon me. When I was in chiropractic school at Life College, Lloyd Table Company, which was a table company started by a doctor who was also a mechanical engineer. He devised a table that could actually stretch the human body by securing it also and stretching it to take tension off. And actually, that was kind of like the first style of decompression, because we're decompressing tissue. Now, decompression in and of itself is totally different, but the table that I utilize is a table that stretches the patient out, and I'm able to move their lumbopelvic and lumbosacral region in side flexion and forward flexion and extension, so that I start taking pressure off the facet joints, which are the movable joints of the spine. It helps take pressure off tissues that may be experiencing some impingement or some issues. And all of my patients, when they experience it for the first time, they're like, whoa, it hurts, but it's a good hurt. It's like a good stretch, like you're being stretched out and pulled. I mean, I did it to you the other day.
Yeah.
That was the first time. Like you said, you've been to dozen chiropractors.
Yeah.
No one's ever done that to you before, right?
No.
So this table allows me, number one, the folks can't see it, but we've got 4 tables right here that are our therapy tables. And most chiropractors use these tables, and there's nothing wrong with them. I mean, they're $700 to $2,500 tables, and most chiropractors use these to adjust patients on. But when I have a patient that needs what I feel is a little bit more, when I have a patient that can't go down on a table because they're in so much pain, my table stands up like this. So they just have to come up and stand up against the table, and the table will come down nice and down for them. Then my table comes up at different levels for me to address everything from a physics-minded angle of attack. When I make my move, it's so important that my mechanical engineering and my physics background, for me to get the nice, clean accurate adjustment, that I'm in the proper position. This table allows me to do that. It allows me to stretch them. It allows me to balance out weight. I also can do what's called drop table. It has movable segments that move in different ways. So what it does is it makes me a better chiropractor to get the best result that I can for my patient. Just like a race car driver needs a really strong engine and a team to put this car to the finish line, I demand that of myself for the benefit of my patients. How was that for an answer?
I think that's good. Well said. I think that's a unique thing where the table goes up to meet where the person's at
Right.
in pain.
And then bring them back when I'm done,
Yeah.
so that they can get off. And most of the time it's like, whoa, first of all, I've never had a table like that before. People say, I've never seen something like this before. And then they also say, many of them say, I've never felt that before. Nobody's ever done all that to me.
No, that was what I'll say is like I've had lower back problems and bulging discs or whatever it was undiagnosed, but through heavy working out
Sure.
and not the best form. And there's been times where I've tried to get on that, bending down to get on a table where I'm completely strapped myself in, like got that waistband around
Right.
and in pain. And it's a hard thing to do that. So I would have really appreciated someone meeting me where I'm at.
Sure. When
And
people are in acute pain, I want to try to help them as much as I can.
yeah, I can see that. That's that acute pain part. Uh, there's like a 60-year-old man. His name was Dave that came to see you. He's been in a motorcycle accident, if you can
Oh,
remember that. And that was about 2005, as far as we understand. And he lost his lower left leg. He cracked his pelvis. He even broke his wrist. So like what happened and what happened when he walked into your office and like, what is the result? Like, just kind of walk me through that.
so Dave's a pretty smart guy. He was in a motorcycle accident where a lady blew a light and she hit him on the side, and the frame of his motorcycle was on one side of his leg, right at the knee. And of course, the car hit him on the other side and he lost his leg. And he does physical work, and he's been limited because he hasn't found a doctor that he had a chiropractor once that really worked him well. And then as he got older, the doctor retired. And then he went to various doctors that didn't have the same kind of table that that doctor and I have. And so he came to me, and he's been my patient now for a while. And I love seeing people that don't give up. And Dave's one of those guys. He doesn't give up. He doesn't let the pain stop him. He seeks out somebody. He kept seeking out, found us as an office, and we've been able to reestablish good motion so that he can continue to do his job. I won't say what it is because people might know who I'm talking about. It's a small town, but it's really, it's another one of those patients that you wake up in the morning and you call them up and say, how was your first treatment? And hey doc, it was great. And another one of my many patients that I live to see another day for, to help these people that are hardworking people that are just trying to make it through and get rid of that pain so that they can do the things that they love doing. And whether it's their craft or their job, their business, their being with their family, it's guys like Dave that we're honored to work with, really honored to work with hardworking people. That's what it's all about.
Yeah, that's amazing. Now you've treated, I think on like when I looked online, you treated over 30,000 patients, as I
Easily.
understand.
Yeah.
Easily. What do you think that number is right now?
Actually, I think it's closer to 40. And the reason I say that is because there's been times where I've seen 10 new patients in a day. I mean, I'm thoroughly exhausted. I've seen 100 people in a day for regular adjustments, but that's a 16-hour day. I'm not seeing that many patients now. I'm much older, but of those, I'm going to say a quarter of them were car accident cases, a quarter of them were workman's comp cases. And then the other 50% are athletes and people that fell down at home in Chicago, falling on the ice, what have you. And so I've seen a lot of folks. And you know what it's taught me is that it's the more I listen, the more I learn. The more I listen, the more I learn. I can learn so much from just listening to my patients as to what's really going on with them. And the more I dig into their past health history, it helps me render an accurate differential diagnosis to move forward. That's really important. It humbles you when you've seen so many people. You can ask me what are my most memorable cases,
Yeah,
actually.
probably. I mean, we already touched base on some of them, but I'm really curious on like some of those ones. I mean, it's a lot. You have had an amazing body of work here helping people, getting them healthy. So is there anybody that just like really stands out to you?
I'm thinking about a few of them. One was a 19-year-old boy. This was in Chicago, a 19-year-old young man in Chicago that actually an attorney called me and said, Doc, would you help this patient? I go, tell me what's going on. He said, he was a 19-year-old, Chicago, sunny day, August. He's driving either to or from a job site and hot work van, painter, no air conditioning. He's got the windows down. He's got his left arm out the window and he's just driving the truck. And he's driving and there's no median in the center and somebody crosses over the yellow line, sideswipes the van, mangles the arm, and the doctors were able to allow a 3-inch portion of the humerus. They had to amputate his arm just below the shoulder at about here.
Wow.
And I'm like, this is a horrific. Well, I can't do anything with that. And he goes, well, I heard you do, because we have a physical therapist in the Chicago area. I mean, in my clinic. And he said, if we can get him qualified, they will fit him with a bioelectric arm, but he has to get qualified for that. So we have to do a biofeedback. And so we did some research and we found equipment. It's basically like computer games where we were hooking up leads to his arm. So let me back up and say that when the kid came into the clinic, he walks into the clinic, he looked like a young man who was, a good looking Hispanic kid who looked like he was about ready to take his life. Understandably, he was very depressed.
Mm-hmm.
We worked with him for, I think it was 7 months. We worked with him every 3 to 4 times a week. We had him in front of the computer. We're doing therapy on his arm, maintaining mobility of that little stump, while then hooking him up to biofeedback to try to get him to play computer games and encouraging him to continue to move forward because he had a good chance. And it took 7 months. And then he was gone. We sent him off for his fitting. And he came back to the clinic. He opened the door with his left arm and he put his hand up like this and he gave us all a hug. How do you not love that, man?
Yeah.
That's one. And then talk about strength and willpower. Guy comes in, he says, hey, I hear that you're the chiropractor that works on all my buddies on the field, soccer player. And he goes, I got a problem with my low back. And when he's walking, I'm noticing he's walking a little strange. Now, he's missing his left arm also. Now, his left arm is just at the elbow, just like he's got a little bit of an elbow left, right? And I asked him, what happened? He goes, that has nothing to do with this. It's my back, when I have a problem when I go to kick the ball. He's like, forget about the arm. I've been like this since birth, but I truly noticed that this was not a birth defect. There's something else because everything else looked completely normal. So I'm working with him. I'm helping him with his lower back. I'm, initial visit, and I'm like, something's up, and I say, let's take your shoes off. I want to assess your feet. He kind of looks at me. All right. He goes, it's not my foot. And so he doesn't have a foot on the left-hand side. He's missing everything up to the ankle. And it's just the metatarsals Metatarsals are just gone. Um, I look at that and I go, you got to tell me what happened. He's like, okay. My parents had a pig farm in Mexico, and they left me with my grandparents. My grandparents were watching over me, and I was in the crib. I don't know, several months old, and one of the pigs got out, and my foot was outside of the crib, they say, and started eating my toes. And then he went up. I guess he pulled his leg in, and his arm was over there, and the pig started eating his fingers. Ate all the way up to the elbow. They found him, took him to the hospital, did what they could. He's like, I've been like that since I was an infant. What do I know? It's what God gave me. Hardworking construction guy. And he's playing soccer. And when we took his shoe off, he had like newspaper packed inside the front. He goes, this is my shoe. I can walk like this. And I got the same thing in my soccer shoe. And that showed me the resilience that some people have, you know? Here we are, we get a hangnail and we're crying, or, you know, our hair doesn't look right. And here's this guy. Come on, man. That's a rock star. You know, a man that can power through that. Those are the stories, man. I get weird stuff all the time, and I love it. I want to help these folks, man. I don't get afraid of this stuff. Let's go for it. Let's see what we can do. Now, an interesting thing, Joshua, 7 months working with that kid. If I had this MRI technology didn't exist back then. What I can do with these machines now, we could have done this in 2 to 3 months.
It could have been reduced that much.
Oh, yeah. We could have strengthened that area because our machines can build muscle in as little as 4 treatments in certain muscle groups. We can build 25% muscle size, 25% muscle strength. That's insane. And that's the MRI machines that I was talking about earlier. It's revolutionizing care. It's the functional components of these new machines are just mind-blowing what they can do for patients. My decompression patients that I normally would say 30 to 40 visits for a very bad disc, we're getting done in 12 because we're incorporating M-Sculpt Neo to build muscle and to energize the region, and M-Cella to work on that sacral plexus and to energize the muscles there. And I truly believe there's more going on that has to do with cerebral spinal fluid flow, but that'll come later when we continue to do research with these machines, because we're a clinical research site for BTL, and we're proud to be associated with them for this.
So tell me, you know what I'm hearing is, like, I'm sure a lot of people are thinking MRIs are really expensive. Like,
you know, let me tell you something. An MRI, depending on where you're going, could cost you $5,000. But I've created a network of centers because I tell them, look, I've got a lot of patients to send you. And don't give me this crap about expensive MRIs. I know what the Medicare rate is. I know what the minimum is that you'll accept. And I get MRIs for under $400 with a quality reading from a quality machine. 3.0 Tesla, never go with anything less. I don't like open MRIs. Why? Because the quality is crap. The majority of MRI machines need to have a closed bore so that you get a great image. Oh, but we have software and everything. Just show me the pictures. When you show me the MRI images, and I've taken classes, I'm not a radiologist, but I've taken lots of classes on how to read MRIs because I want to know. I want to know. So I can get an MRI from anywhere from $300 to $400. Right now, I think the going rate is about $350, $325. Is it worth it? Heck yeah, it's worth it. It's the best exam. It'll show you if there's a tumor. It'll show you if there's fluid that shouldn't be there. A shoulder. It'll show you if you've got a rotator cuff tear. It'll show you if your medial meniscus is torn. Do you have a slap tear of your labrum, which is, you know what that is?
Yeah, yeah.
Do you have a problem with the hip? Is there necrosis going on, which is, death of bone? These MRI is a valuable tool. It can tell you so much. And to not use one, in my opinion, is not good medicine. If a patient's not getting better within 30 days, they need an MRI. And gosh, it brings me back to, why I'm so passionate about MRIs. How long is this now? 20 years? 15 years? In Chicago, when I practiced there, Joshua, I had a great practice. I had some amazing patients, like the guy who lost his arm, the young man, like the guy who got his foot and arm eaten by a pig on the family farm. I had doctors coming to me. I had lawyers coming to me. And I'll never forget Attorney Bob, a wonderful man with a wonderful family, a wife and two beautiful girls. And Bob would come in once a week for an adjustment and a deep tissue massage. And Bob continued to have this pain in the lower back, which didn't feel right to me. It didn't feel right to my hands, because I put my hands on a lot of people. And I told Bob, this doesn't feel right. I want you to go to your primary doctor. I'm fine. I go, Bob, I want you to go to your primary doctor. I'm writing a prescription. I want you to go. He went. His primary doctor said it's back pain. It's probably osteophytes. We did some x-rays, didn't see anything. I did my x-rays. I saw that there were osteophytes. Yeah. I said, you need more. Insurance wouldn't pay for an MRI. I go, I don't care they don't pay for an MRI. He goes, I'm going to go see my orthopedic surgeon. He went to the orthopedic surgeon. Didn't order an MRI. Months go by. I go, Bob, I want an MRI. This is how I started being so passionate about it, because damn it, Bob had metastatic carcinoma that started in the lung and went to the spine. In 6 months, we lost Bob. I went to the wake. And I will never not do what my heart tells me and what my mind tells me as a diagnostician for my patient. I will always do the right thing for the patient. Forget about the $350. Forget about the insurance company that says no. The hell with them. Dig in your pocket and pay for it. Go get it. Get it done so that you can enjoy your life with your family. Because if we had caught this sooner, perhaps we could have kept him around. So, yeah, diagnostics are very important, as is the workup of a patient, as is the treatment we give and working with other professionals. Yeah, I got to meet those other doctors there. I didn't say a word because I was not happy. You know, when you can do more, you better do more. That's how I feel. All right, on to the next question, shall we? Or the next topic.
Yeah. No, I mean, it's really impactful. Was Bob like he was a patient of yours? Was he, you said he was an attorney. Would he also refer patients? Because I know this is something that you work with. You work with attorneys, or attorneys send you patients because it's actually like an important part of the business, and obviously for them to represent their clients. So can you tell me a little bit more about that?
Well, I think that's where a doctor's pedigree, their curriculum vitae. I think my CV is 25 pages long because I'm constantly taking courses. I've been certified as an impairment evaluator for years. I've studied the 4th guides to the AMA, Guides to Permanent Impairment, the 4th edition. I'm certified in the 5th edition. I just got word that I passed this, the 6th edition. I just got word, because Florida relies on the 5th edition. I got word that I passed that exam also, so I'll be adding that to my curriculum vitae. And I do it to advocate for the patient and to make sure that we're giving them a proper evaluation for impairment. So what does all that mean? That my information gets put on line now so that attorneys, when they're searching, I got a patient that's hurt in this area. Who do I send them to? Hopefully they're going to look at our website. Hopefully they'll read my curriculum vitae. Hopefully they'll see how passionate I am about the work I do and how I love being in front of a courtroom. I love doing live testimony in court because I got 6 people or 12 people in the jury, and I get to talk to them about chiropractic and about rehabilitation and about diagnostics and how we were able to take this patient from point A to point B. Attorneys that care for their clients are looking for good quality practitioners to help bring them back to as close to a pre-injury state as possible. And in the case of Bob, he was a criminal attorney, and yet one of the guys in his office, who was a personal injury attorney, had sent me a couple of clients, that needed a Spanish-speaking chiropractor to work on them. And then the guy said, "Oh yeah, the patient said they do a good job," so he came in and he was our patient, for years, for like I think 3 or 4 years he was our patient. And his condition continued to degrade, and anyways, what happened to Bob. But attorneys, I think attorneys are always looking for a good quality doc to send their patient to. And number one, they need somebody who's going to document their case. That's so important. But our work is, first and foremost, it's all about the patient. It's all about getting them better. And if they happen to have a car accident case or a workman's compensation case, it's important that we document what happened so that the attorney can do their job, because that's their job. That has nothing to do with me.
Yeah. What do most accident victims not understand about their medical records that can actually affect their legal case? Because I know this is an important part.
And it's not only that, but something that's very difficult that I've seen happen time and time again is that patients come to me and they're like, "Oh yeah, that attorney, they did a horrible job for me on my last accident." And I go, "I know who that attorney is. They've got a very good reputation." "Well, he didn't do crap for me." People don't understand how all this works. They really should do their due diligence. But quite frankly, I didn't know how all this worked until I got on the short end of the stick. And I'll tell you what I mean by that. When someone's involved in an accident, you've got different components of insurance that are meant not to just abide by the law, but to actually assist the patient in many different ways. And I'll give you an example. In Florida, it's a no-fault state. So you have your insurance and you have your PIP insurance, and you may or may not elect to purchase bodily injury insurance, which means that if you're at fault, you can buy coverage to cover the damage that you do to others. You have underinsured motorist coverage that you as a buyer of insurance can buy. So as people become more successful, a good agent will advise them on the appropriate coverage that they think would be good for them. And then of course it's a give and take game. You want more insurance, guess what? You got to pay for it. You want lobster, you got to pay for it. You want steak tips, it's going to be a little cheaper. Insurance is the same way, and it's not the attorney's fault. People have to understand that. So buy the best quality insurance you can buy. And people have to also understand, if you've got a bunch of tickets, your insurance rate is going to go up. If you've been arrested for something, your insurance rate is going to go up. If you've got a bad credit rating, your insurance is going to go up. Why is that? Because you're a risk. You're a risk. So stay clean,
Mm-hmm.
Drive responsibly. Buy as good of insurance as you can possibly afford. And I'm going to tell you something. When you get in an accident, if you have the minimum, you're playing roulette. You're going to get upset at the person that hit you, that made an accident. Yes, it's their fault. But let's say you're sitting at a traffic light or a stop sign, and you're just sitting there minding your business, and you get rear-ended by some kid doing 50 miles an hour. And in so doing, your child who's sitting in the back seat suffers a traumatic injury. and you didn't have good insurance. Shame on you. Because here's the reality: that 19 or 20-year-old, or whoever it is that also has crap insurance, your attorney can't do anything for you. They can't do anything for you. You can get, if you've got your PIP insurance, you're going to get your $10,000 of insurance. And I'll tell you something: when people go to the hospital for just, a bang up injury, the hospitals are very aware of what's going on in the insurance business. And I have to say, I will come out and say it, that there's a lot of wrongdoing going on. When a patient comes in, and if they haven't had a traumatic injury that involves significant physical findings, in no way, shape, or form should they be put into a CAT scan machine. Number one, clinically, it's not really indicated. They've had trauma, but how much trauma? They're complaining of this, but how much of this? If a proper evaluation doesn't reveal significant findings, that CT scan isn't warranted. But here's the beautiful thing for the provider of that CT scan. A CT scan takes 3 minutes. If I send a patient for a CT scan, which I never do because an MRI is far superior, CT scan's about $300. I'll send them for an MRI for $350, and I'm going to get a world of information. Now, CT scans are indicated for some conditions, but for an injury, MRI all the time. Much better, especially the centers that I use. But when somebody goes to some of these hospitals right around here in Southwest Florida, that $200 or $300 CT scan that the providers normally charge when they know you've been involved in a car accident, they bump that up to $12,000 typically, or 10 grand or 8 grand. Why? They know everybody's got PIP insurance. Bingo.
Wow, they just suck up all that money.
Boom. And then the attorney sends them to a provider who's hoping that there's a little bit left to take care of them. We can only do so much. We can't work for free. Now, as a family person, as an individual who's moving up in the world, working hard and stuff, buy as good of insurance as you can, because it's so important that you protect yourself and the ones in your vehicle. And also that you protect yourself against you looking down at the phone and you hitting somebody from behind and causing catastrophic damage. Because if you have assets, an astute attorney is going to come after it if you're at fault. Now, if I'm sitting at a traffic light and I get struck from behind, or somebody makes a mistake and they hit me, and they're accidents. Most people don't drive into you because they want to. It's an accident. When that accident occurs, I couldn't give a rip what kind of insurance you have, because I purchase good insurance. Why do I purchase a very good policy? To protect myself and the occupants in my car from something that occurs due to the negligence of others, or if I screw up. Also, the uninsured motorist or underinsured motorist portion of your policy is not that expensive, but the coverage that you can buy $1 million worth of coverage. It's going to cost you a couple $100 a year if you've got a good, clean record and you're driving a safe car. It's not that expensive. It also, if you buy a $500,000 BI, bodily injury portion of your policy, that's not going to cost that much. But that insures in case you screw up, that you hit somebody, then you cause damages, that they're not going to come after your assets, because the attorney's probably going to be fine with, the damages probably won't accumulate to a level of severity, hopefully, that they don't come after your other assets. You need to protect yourself. And so that patient that says, oh, that attorney's, they didn't get me anything from my accident, they're a crap attorney. You had crap insurance. And guess what? The person that hit you had crap insurance too. You can't sue an insurance company for their client if the client didn't buy that coverage. You can only go for the coverage that that person purchased, and that's it. You can't squeeze blood from a turnip. You're not going to get a favorable settlement. So in the case of somebody that has great insurance and somebody hits you and flees the scene, If you've got an uninsured or underinsured motorist and you've got all these other coverages, you paid for that coverage. You're going to find some representative, an attorney, or maybe you deal with the insurance company on your own, but you find a good attorney to help you and a good doctor to treat you and get you to the best place, and the documentation is there, and then you go and you settle your claim. And that's, that's the dirty business of car accidents, that people get upset at their attorneys. They need to get upset at themselves for not buying proper insurance. It's not that expensive, unless you're a person who happens to get in accidents all the time. You're a risk, and people get upset. They're trying to game the system. Stop gaming the system and game yourself, man. Be responsible, buy good insurance, drive safely, and everything's going to be okay. So yeah, I know I went off on a tangent here, but it upsets me how patients get so upset when somebody else hits them. It's like, most of the time it's an accident. So cover yourself.
Yeah. What do you say to somebody that's been like somebody right now that's in a car accident?
Yes.
They're sitting in their car right now. Like, what would you tell them? What do they need to do? Like, let's say their neck is hurting. Let's just give a point in there. They got a stiff neck. Obviously they're walking around, but they're walking away, but they got some stiffness. What do you tell them to do?
Okay, so you're sitting in an accident, you get rear-ended, even if you're in the parking lot or what have you. Number one thing you do is you call the police and report the accident. Number two is you call your insurance agency and you report the accident. Number three, if you can, make sure that you get the license plate of that person that hit you, because there's a good chance that some of them are going to flee the scene. Okay, and then if you can safely. And then you need to get evaluated by a quality doctor. Do your research, get online, but make that appointment quick, because now here's the interesting about one interesting thing about care that's necessary. When somebody gets in an accident, Joshua, and you have, let's say it's a rear ender, and you've got that hyperextension and then the lash, the hyperflexion injury, there's a lot of changes that go on physiologically in your body. And left untreated, that will manifest into arthritis in 5 years. Well, it'll start within a year and a half or two. 5, it'll get worse. It'll probably continue to get worse. 10 years, you'll be lighting up when I take an x-ray of you in 5 years and go, I know you got in an accident 5 years ago. When you send them for an MRI, they're going to have what's called modic changes. The bones just change and they look ugly on MRI. They're ugly because they've been abused, they've been injured, they've been hurt. People think, oh, it's just a little whiplash accident, I was fine. Oh yeah? Let's talk about that in 5 years. When an athlete cracks their knee open or cracks their knee, they have a bad injury to the knee. You cry if you're a smart guy or gal, because damn it, this is going to hurt me when I'm 50, when I'm 60, when I'm 70. You look at these athletes, the power lifters, the guys that destroyed their hips. They can walk, some of them. When you hurt yourself and you get in a car accident, go get checked out by a quality doctor. And if they're not really doing an exam and checking your muscle strength and checking your neurological system, does everything feel right? Is sensations right? Range of motion, your balance, your ability to move your neck in all these different ways. Are they taking notes on all these things? Are they palpating your neck? Are they checking your neck? Are they doing certain tests like maximum foraminal encroachment, distraction tests, straight leg raiser, Kemp's test, all these different orthopedic tests that orthopedic doctors, physical medicine doctors, chiropractors, we do these tests. We're taught that. If they're not doing that, you need to go see somebody else, because if they just sit there and hand you a prescription, you're in the wrong office. You need physical care to be started immediately. That's why athletes, when they get hurt, they do surgery immediately and they start them on rehab immediately, because the tissues are fresh. They want to rehab that immediately. They want to get them into motion, get them into training. The worst thing you can do is sit home and watch TV. The worst thing you can do is not move a joint. If If the joint has been injured, it needs to be evaluated and assessed, a proper diagnosis, a working plan of action, a treatment plan, and you stick to the treatment plan so that the best outcome can be halved. If not, or had, pardon me. If not, shame on you because you're the one who's going to suffer. And if you don't do your call within the first few days, the insurance company's going to get suspect because they should. You know, you get in an accident, report it. Tell them, I hurt my neck. I'm going to go see a doc. They're going to tell you, do that. The insurance companies want you to get this thing going and get it done.
Yeah.
They're not all that bad.
Well, and I'm hearing that you also are like the functioning, they're just not giving you a prescription and walking away, which is sort of what I call like masking the symptoms, and you're really about restoring function. So like what's the difference between that, and like why does that matter when somebody, chooses between you and a pain pill?
Sure. Good question. Great question. So a pain pill is an anti-inflammatory or a some sort of medication that's going to hide the pain. It's going to mask the pain. Is the pain still there? I'm still here. Is the problem still here? I'm still here. So pain pills are very much needed. Sometimes the anti-inflammatories can be very helpful, but you need to start with physical medicine. It's all been documented that to just take pills and not do any rehab is not a good thing. When you hurt your knee, what do they do? Physical therapy. Why? And what does a physical therapist do? He makes you work, or she makes you work. They make you do exercise. We've got to get things moving again. Medication does not heal an injury like that. You've got tissue disturbances. And as I mentioned, ligaments don't heal, they remodel. They actually change to a different type of tissue that's not as elastic and not as mobile and not as supple as it was when it was uninjured. It's kind of like when you're cutting into a steak and you find that one area that's bad, it's like, it's just not right. This kind of stuff happens in our bodies deep. There's a lot of changes that go on. So it's important to start that rehabilitative process early on. Stick with it. Stay active. Don't talk about the pain, just letting it get in your head. Get moving on it. Get it handled so you can say goodbye to the pain.
Yeah, that's amazing. I heard earlier you kind of touched base on it, but I never actually asked the question. So you're actually bilingual.
Yeah.
And obviously starting in Chicago, heavy Spanish community, out here in Southwest Florida, heavy Spanish community. So how has that impacted your practice and also with the patients? I'm just kind of curious on where you stand on that.
Yeah, my mother's from Puerto Rico. My father was Yugoslavian. So my friends call me a Yugo-Rican. But I speak Spanish. I have a large Hispanic clientele. As we know, they're very loyal to the doctor. They are hardworking folks, and so I pride myself in being available to them, and I welcome them. To me, the garbage man, the CEO, the engineer, the pilot, they're all the same. Everybody to me is the same. If they respect me, I respect them. And if they don't respect me, I probably need to respect them a little longer, and then they'll get the picture. But Hispanics are a big part of our practice. Lehigh Acres is loaded with Hispanics. We have many Hispanic patients, and we take care of young and old. A lot of the Latino culture prefers hands-on treatment to medication. That's something that's been evident, and probably because in many parts of the world where it's Spanish culture, they may not have access to traditional medication. They're not seeing like we do here in the United States, where every other commercial is take this. They don't get that, and they know that eso no me va a hacer nada. That's not going to do anything for me. I want the doctor to move my bones. X-rays first.
Yep.
Right? Good diagnostics and X-rays first when necessary. So
yeah. Do they appreciate that? Because I'm sure even then it's mostly hands-on, but even that technology is somewhat probably unfamiliar or new. So.
Correct. And when patients come to me, I take their X-rays and I hand them a thumb drive with their X-rays, and they're like, wow, nobody's done that to me before. I mean, that's a great thing. When you have good technology, it literally takes me about a minute to copy all their X-rays onto a thumb drive, give it to the patient. They can And I tell them they can go look at it. Don't be afraid of this, that, and the other. That's gas in your bowel. That's a gastric air bubble. That's all normal. And here's what your bones look like. And this is, so they appreciate x-rays because very few times have they ever seen what they look like inside. Many people haven't. And I think it's an important thing. And it's also a good baseline for someone to hold that, because on the x-ray, it's going to be imprinted with the date it was taken and all their pertinent information. So let's say that something happens, let's say they get in a wreck 3 months later and there's a fracture and they can't say, well, you had that before. Well, I happen to have this thumb drive from Dr. Ivan that was done 3 months ago, and I didn't have that accident. I didn't have that crack in my vertebra then. Because things happen. Sometimes people break a vertebra because of a rear end collision or a side impact, and they'll break a portion of their spine. And sometimes it's very bad, but most times it's not. Like they can fracture what's called a transverse process. Excuse me, it can be painful, but a transverse process fracture does not require surgery. It's just one of those things. It's may not heal on its own, but it's not going to incapacitate the patient usually, and many times it doesn't create long-standing functional deficits. So x-rays are important.
Yeah, I really got that. What's one thing that in your practice that, it's coming up for me is like, what's one thing that you refuse to do that maybe other clinics do? Like, what's the differentiation here? Do you have anything that comes to mind?
Well, crack my neck without a good exam, or sometimes people walk in, I just want my neck cracked, like they can go to these other places that do joint work and they go there and the doctor doesn't take any x-rays, doesn't do much of a health, and you just pay a membership fee for a month and go in there and get your body cracked. And that's not our forte. We're a more of a concierge level clinic or injury care clinic that will do more. We also will not fudge records, like, oh, say that this happened, my accident was 3 weeks ago, but why don't you just put down that I came in 2 weeks, ago, so that I'm in within the 14-day rule. We don't do anything like that. And we get asked, some patients, it's in their culture, and I won't name what cultures those are, but some patients come around here asking me to pay them to come in because they were in a car accident. I've never heard of such a thing until I moved to Florida, but that never happened in Chicago to me. But here it's a common occurrence, and I'm like, what in God's name is going on? There are lots of clinics that should reassess the way they're doing things. Many doctors, many multi-specialty offices that should really take a hard look in the mirror and determine, is this really the right thing to do, to pay your clinic to come in? Pay your patient to come in? There's a lot of that going on.
Wow.
And what kind of care do they get? Certainly not the type of care that they get here at Novari. That's for sure.
No, it makes a big difference. The last question I think you've already answered, so I don't think there's anything for me to really say that's left on here. I got a lot of my questions. I want to transition to showing some of the devices.
Cool.
And move that. So I think like the idea is if maybe you could just help, or somebody can help, as well as we can just get it into positions, and then I'm going to keep the cameras rolling, and
okay.
then we'll just let it go. So what is this? It says the word Sculpt Neo on here. So tell me a little bit, what is this thing?
That is one of the applicators of Sculpt Neo. So the Sculpt Neo is a device that provides high intensity, focused electromagnetic pulse waves. Now there's various manufacturers of electromagnetic devices. The pulse wave technology has been around for several years now, but this is the most powerful machine on the planet. And this has dual purpose. So we can build muscle, but we can also burn fat. We can also work on joint work. We can actually help restore function of joints. And on our website, we actually have some video testimonials of patients. Like there's a lady recently that came in, new resident in town, and she's, for the past 5 months, Renee has had a rotator cuff tear with a slap tear of her glenoid labrum, which means that there's a portion of the labrum, which is a little structure that is very important that surrounds the articulative surface of where the humerus articulates with the glenoid fossa, which is a part of the shoulder blade, if you will. And where those two come around, there's a tear that sometimes occurs, and it's called a slap tear. So that tear, when that structure gets irritated, it's like, whoa, it's super painful. This happens a lot with athletes. This happens a lot with people who take falls or repetitive injuries, repetitive stress injuries. So we took that machine after, and we actually paired it up with another one we'll talk about in a minute, which is the M Vital, the brand new laser, which is a robotic controlled laser, which is like unlike anything that I've ever worked with. And I think this is my 9th laser. This blows everything out of the water because number one, it's at a waveform that's very, very powerful and very good at penetrating deep. We can get into almost 2.5 inches under the skin, which is just unheard of.
That's wild. I was thinking you could just put a heating pad, but like this is like a whole nother level of.
This is decreasing inflammation, increasing circulation, stimulating the mitochondria to go on full alert, bringing energy to the tissues to begin the healing process, unlike any other laser I've used. And I've had 60-watt lasers. I've had various ones. I don't even want to mention the names because I don't want them getting mad at me, but they're all crap compared to the M Vital. And I'm not getting paid by them to promote this laser just because, I think it's, something new. This thing works. And if you look on our website, you'll see our patient, Renee, and she gave us permission to post it. We were all in tears after seeing her motion from the first time after 5 months, what she could do. She couldn't bring her arm any farther than this back. She couldn't really go any farther than this prior to putting the laser in. And she said, "Oh, this really scares me to reach around back to like pull her pants up." We did 15 minutes of that laser and she's like, "I can do it." She started crying. Then we backed it up with M-Sculpt Neo.
So this device right here,
that one right there, which is the HIFEM, high intensity focused electromagnetic pulse waves, which is going to do 20,000 contractions in. Yeah, I know.
So this is it right here. Where
that's where there's actually a coil of energy that's in there that's going to emit energy out, and then there's a sensor there that reads, and it will also emit infrared heat, and that heat is going to warm up the tissues when it comes to preparing the tissue for activity. Just like when you warm up your muscles, the machine was going to warm up the muscles, and then we're going to pulse it with these pulse waves, which just rehabilitates the tissue, makes the pain go away. It modulates pain, it increases strength. It's just a fabulous tool. I can't practice without it anymore. I mean, it brings everybody to a level of health and rehabilitates their injuries at a whole different level, so much quicker.
Yeah, it's amazing. It's an amazing device, and for a lot of the people that probably can't even see, there's a whole piece of equipment that gets brought around from it. This is just the paddle that I imagine gets like attached to the body.
That's correct. And there's 3 different paddles at this time. They're constantly developing more. That little button that you see there is a on-off switch, so the patient always has control. Yeah, they put their middle finger over that and they just press it to turn it off. Yeah, so in case they're ever like, oh, it's a little bit too much, they can interrupt the therapy. There's 2 paddles that we use there, or applicators, and then we have 2 other sets for different body parts. So we can. The reason I bought this is to help rehabilitate patients that have severe issues. I heard that they were coming out with functional protocols, that they just got FDA clearance for chronic intractable pain, post-surgical pain, acute and chronic foot drop, peripheral neuropathy. So people that have diabetic neuropathy, peripheral nerve problems, they got clearance for this to be used on that.
And this will help
FDA clearance.
stimulate the neuropathy, like to
It
reduce it,
to
or
help reduce neuropathy and to regain function. It's all about function, function, function.
yeah,
Pain is a terrible thing, but if we can get people to function better, then they can augment their therapeutic rehabilitative process with therapies like this.
yeah.
So post surgical pain also. This is just a godsend.
I was gonna say too, like what about after birth or something? Like a woman, is that something that could be used for this? Like if they have,
Absolutely. They have, when a woman gives birth, many times they have what's called diastasis recti, and it's like a splitting of the abdominal region.
yeah,
And this has been shown to drop it by 20% in as little as 4 treatments. The treatments are spaced out one time a week. They don't hurt. They're on the machine. They're laying still for, I mean, laying on a table. They can be reading or on their phone for 30 minutes, and it's helping close that gap. It's helping strengthen that region. We can also burn what's really dangerous, what's called visceral fat. We can do different therapeutic procedures with this machine. It has a functional program. It has a sculpting and heat and fat burning program. We can dial it in to do different things, and using the different applicators, work all over the body. We can burn gluteal fat, or we can build the gluteal muscles. Many times you want to leave for form. You want to not burn too much fat. You just want to build a muscle to give a nicer anatomical look, let's say. We can build quad strength. Most importantly, for anterior compartment syndrome in the lower leg, we can work on that and help patients regain dorsiflexion because they've got foot drop. Foot drop is a horrible condition.
yeah. Tell me a little bit about foot drop, because I'm
Foot
not
drop,
familiar with it.
when a patient has, perhaps they've got a lumbar disc herniation that's been there for way too long, they didn't get assessed properly, they didn't get treated properly, that nerve will forever be damaged. That muscle that it's leading to cannot function properly. So when we walk, we have to lift our toes up. If you don't, you're going to fall because your foot is not able to dorsiflex. It's not able to lift up. As a child, when babies are learning how to walk, they fall down because their brains are making connections. They're like, oh yeah, I got to lift my foot up.
Mm,
They start walking slowly, and then all of a sudden they go. Whenever you're running, you have to bring your foot up, right? And then you make your heel strike and toe off. Well, when you have foot drop, and you've seen patients walk where they lift up their foot and they're stomping it like that. It's kind of like there's a slapping sensation because their brain says, I've got to lift my leg up higher to prevent myself from falling down and breaking my face or breaking something. This machine can help rehabilitate the strength in those muscles so that they can regain some of that strength. I probably can't get them back to 5/5, which is the gauge of full muscle strength against full resistance. But if I can get somebody from a 1 to a 3 or a 4, that's awesome.
yeah,
And
that's a
that's what
huge difference. The
it's a
quality of
huge
life.
difference because then they can walk without a cane. They can walk without a ankle foot orthosis, an AFO brace. They can function.
Yeah,
They can function. And that's what it's all about. It's
that's
all about
amazing.
function in my life.
That's amazing.
So that's a great, great tool. It's one of the many devices that we have to help people regain their function. Again, I keep coming back to that. But,
No,
on patients that have sciatica, that have low back pain, when we work this on the paraspinal muscles and on the glutes. Oh, another thing that's super important is that when a patient gets injured, Joshua, many times what do? They stop doing the things that they were doing. And when you look at our older population, most of them have lost huge amounts of muscle mass due to sarcopenia. Sarcopenia is that degradation of muscle strength that occurs. It happens naturally. Muscle size and strength depletes after the age of 30. It starts going down. When somebody has an injury, they may be even more reluctant to move. They may start getting out of the chair, by using tables or using the armrest to push themselves up. When it's related to an injury that's involving their rehab that needs something like this, we can use this to help strengthen their quads, their hamstrings, their glutes, their paraspinal, which is the muscles along the spine, to help rehabilitate them so that they can get back to a better level of function. And sometimes we incorporate this into their accident case This is expensive technology. This is expensive therapy. But once again, if the patient has sufficient insurance to pay for this kind of stuff, we can use this to help get them to their maximum level of recovery as quickly as possible. And if need be, we can do maintenance by, once you get through the acute phase, therapy for maintenance on this is about once a month. And that's what patients come in for. We have patients that come in that were referred to me by pain management facilities here in town. And they come in once a month for therapy. They get decompression, they get M-Sculpt Neo, they're on Amcella, now they're getting the new laser, and they're like, I'm back.
Wow.
And it's really cool to see them come back with a spring in their step. And they show me when they go get up, they stand up. They don't push themselves up.
And I wanted to touch base on that because that was something you mentioned earlier about like your mother. And if you're okay with talking about that, about her, like 93 years old. And what was like, you got her to not push herself up by her arms. And
That's correct.
And tell me a little bit about the problem of that. Like, what is anybody that's probably watching this or knows somebody that gets up like that, and what's so wrong about pushing yourself up with your arms?
That's a great question. And it's so interesting how we don't think about that. When you routinely push yourself up with the arm rest or the armchair or grabbing a table, you're not using your muscles as much. Why? Because you don't feel as confident, or your knees hurt, or your hips hurt. Let's go down a few months. Let's go down the road another year. Your mind is there. You're feeling great. You love your family. All of a sudden, your balance is off. Why? Because you haven't been using your muscles. Why? Because you've been pushing and lifting yourself up with your arms. Use your butt. Use your legs. Exercise. Strengthen those muscles so that you maintain stability and prevent a fall. Because if you fall and you break a hip and you're over the age of 65, 1 out of 2 people that break a hip after the age of 65 will not survive a year. That is the statistic in this country. 1 out of 2 people over the age of 65 that fall and break a hip will die within a year. Those are not good odds.
No,
man.
It's not good odds at all.
And so that's why you need to strengthen those muscles to prevent that, because it's almost always, if it's not a cerebellar or a brain issue, a balance issue within the brain, it's almost always a weakness issue.
And this is where you're using your arms, getting up, you're slowly weakening yourself. You're doing it out of convenience, but not for the betterment of longevity.
When you don't know about it, it's ignorance. But when your doctor has told you about it, and Dr. Ivan's always going to tell you about that, if you don't do it, or if you don't start changing your ways, shame on you. Because it's right here. It's right in front of you. We use this when needed. But honestly, if people were to start doing stretches, if they were to start like getting out of the chair, like every day when I'm at the edge of my bed and I go to get up, I use my legs. I don't ever push myself out of bed. Use your legs and stand up straight. Go for a walk. Halfway through your walk, stop and do a few minutes of yoga. Go for another walk. Did you know that if you, let's say you have breakfast and you just go about your day, if you have your breakfast and let's say it's oatmeal, let's say it's a couple of eggs, let's say it's a couple of eggs with some avocado, maybe you make an omelet, you're trying to cut down the carbs, your sugar is still going to come up. But if you go for a walk after your meal, your blood sugar is probably going to, I've been tracking blood sugar. My wife and I have been doing this for a while now because we've read the research, and the research shows that if you go for a walk after a meal, even just a 15-minute walk at a good pace, your blood sugar is going to drop about 30 points. That's huge. What are you doing? You're helping prevent diabetes. Now, my father at the age of 62 died. He had diabetes. He had type 2 diabetes. And they're saying, oh, well, you're going to have it too. And I'm like, bull, you know what? I'm not. I'm not going to let it happen because I'm changing my lifestyle to prevent that from happening. Oh, but it's genetic. No, I think it's epigenetics. It's what you're doing on top of what you've been given to help prevent what is the inevitable if you did what everybody else did or does. So we're changing our lifestyle to prevent that from happening. These machines help us, but it's the lifestyle changes when people incorporate the lifestyle changes after having this that help them prevent needing and requiring more therapies like this, you know?
Yeah.
But this is a lifesaver for many people.
I can see that for people that are already kind of progressed. I'm curious for the people that are maybe listening and they are just starting to use it. What's one exercise? What's one thing that you said kind of walking and maybe doing yoga? Maybe they're not at that stage yet. Or standing at the edge of the bed and standing up. They've gotten too comfortable using their arms. What can they possibly do right now to start strengthening the glutes maybe they don't have a gym membership, but like just what's something they can do at home?
Sure. They can start by maybe at the kitchen counter, having a good grasp of the kitchen counter and just starting to do a little squat and just do a little bit. And that will begin the process, hopefully, of some soreness in the next day or two, where they feel their muscles sore. Great. Just keep doing it and doing it 2 to 3 times a week. You know, I try to do 100 squats nonstop, huffing and puffing, and work those muscles and with no weights, just body weight squats. I try to do 100 push-ups 2 times a week. You know, do 30, 35 nonstop, and I'm walking, I'll stop and I'll do another 25 and I'll walk, then I'll stop and I'll only get to 20. But by the time I'm done, I've got 100 or 105 push-ups and I feel good. Then I go into the garage. I got a little bar over the door. Try to do some pull-ups. If you can't, get yourself a cable machine or some straps and just do some. You have to work the muscles. People are always waiting to the end. And, you know, our Fort Myers office is right by Publix. It pains me to see how people hobble in there. And they're my age because they just don't get it or they don't want to get it. They need to exercise. We've been hearing this for years, and it's easier to just watch a television program and open a box of cookies. It's not the right thing to do. It's just not the right thing to do. And I get that. I attribute this attitude to my mother too, because at 93 and what she's doing to prolong her longevity, I mean, she's on her 3-wheel bicycle every day for about 45 minutes, going around the complex and riding that bicycle. And she's not as fast as she used to be, but at 93, come on.
Yeah.
And she's walking around and she's still cooking and taking care of herself. You know, there's no, oh, here, let me do this. No. I try to help her in my pickup truck. She's like, leave me alone. I'm fine. I'm like, Mom, I'm just here to catch you in case something happens, you know. But I'm amazed. And I always laugh. I go, gosh, look at this gal, 93, you know. And what does she do for her brain? She's constantly playing mahjong, you know. You know, it's kind of like, what is that game called? Jenga with the sticks, right?
Yeah.
When you put it all together, you can look at that and say, wow, that's like a healthy human body. And you start pulling pieces out, right? And it's a little weak. We better move it over here, pull this one out. It starts getting weaker and weaker. And that's kind of like sarcopenia. You're losing muscle mass. And sooner or later, it's all going to come tumbling down. But you can prevent that. You can prevent it a lot. These machines help prevent it too. So if patients are really engaged in trying to stick around for 100 years, good quality 100 years, like my mother and myself are, use the machines. She gets therapy all the time because it just helps. And it's like, come on, Mom, sit on the chair. Sit on the magic chair. Let's put some of this on you. It's important that we strengthen our muscles, and it's important that we take responsibility for these things and not just expect that when you roll into the hospital that they're going to take care of you, because that's not a healthy and fun place to be. You get in there for a couple of days, you can't wait to get out. And many doctors will say, let's get you out of here fast before you catch something.
Yeah, very true. Very true.
Man, I'm just rambling on.
No, you're talking well. This is good. I want to switch it out with I want to talk about another one. What do you got there? That looks like a futuristic Star Trek ray gun.
Right. This is a cool piece of equipment. So this is a radio pressure shockwave or radio pressure wave shockwave machine. It's something that I purchased. I have a high level therapy representative who said, "Doc, you should really look into this machine because I know you like tech." And I said, "Well, tell me about it. Is it functional? What does it function for?" And he goes, "Well, Major League Baseball teams, football teams, basketball teams, all the trainers love this piece of equipment in their office." And I'm like, "Well, what's going on? I mean, I've got other therapy." He goes, "Inside of here, there's a tube. Inside of this tube, there's a rare earth piece of what's called a projectile. This machine has a compressor, and it actually forces that projectile down the tube into this special tip, which then sends an acoustic wave into the tissue. We have to use ultrasound gel while we're doing this, when we turn this on. And you'll hear it going tick, 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 because that projectile is moving at approximately 600 feet per second. And when that projectile, which is super heavy, and when it moves down here and it strikes the stylus here, it emits radio pressure waves. The best way to try to parallel this is if you're playing pool and you have two balls right here and you hit the cue ball just right and it hits this ball and this ball doesn't move, but the ball adjacent to it takes off. This one hasn't moved. How did that happen? That energy came through here striking this ball, and the physics took that energy and projected it in the linear fashion in the same direction and exited that ball that did not move. That's what's going on with radio pressure shock wave. So what's it doing? Those shock waves, Joshua, are actually working deep within the musculotendinous junction, where the tendon meets the belly of the muscle, or beginning, the distal portion of the muscle, and we're going in there and decreasing inflammation by actually creating inflammation. So it sounds kind of weird, but you're actually stimulating an inflammatory response of the tissue that's injured, where there might be some swelling, tenderness, and pain. We're actually introducing an inflammatory process that the body does, and it actually heals itself quicker.
I have a question about this because a lot of people think that inflammation is bad.
It is, because it's normally a indicator that something's off. Mm-hmm. But this is causing an inflammatory response that's actually a healing response. And so in this case, it's bad for somebody to take an anti-inflammatory because you're actually going to inhibit the healing process. This accelerates the body's natural healing process. Listen, if major league teams didn't believe, if it didn't work for them, they wouldn't invest in this.
No, that's true. But that's a lot of money there.
Sure. And like some of our professional athletes, and they have these in their home gyms because it's a very, very great piece of equipment, and we use it all the time. It really helps when somebody has an injury, and let's say they have a bad whiplash event. It really helps with the muscles that help bring and stabilize motion bring motion and stabilize the cervical spine in the head. It is fantastic for shoulders, for hips, for knees. It's just been a great, great addition to the practice. And quite frankly, we can't really work without it because typically we'd get in there and do massage, right? Or we also have something called Graston therapy, which is a great, great therapy. It's these special bladed steel tools. And we're certified. I'm Graston level 3 practitioner, so I've done quite a bit of training in that. And I send our therapists to school to learn. But when we combine that with this, we're hitting home runs on patients. This is great for tennis elbow, golfer's elbow, when patients have a patellar tendonitis, which is in the knee, when they've had a shoulder issue. It's a great therapy, a lot more affordable than some of our other high-end space age therapies like the Sculpt Neo and Vital. But it's great. It's a great therapy.
Yeah, it's amazing. It sounds, and yeah, I was going to ask you that, like, what is the most popular use cases that people come in and like want this? Like, what is it treating? What are you seeing getting the best results with this?
Shoulder sprains, hip sprains, contusions, side impact when somebody gets struck from the side in a car accident. Let's say the airbag has deployed striking them in the face and the chest, and they've got swelling and bruising all around here. Their shoulder came forward because the shoulder, let's say that they're the driver, that shoulder restraint or the upper restraint comes across the on an American car, comes across the left shoulder and stabilizes down to the right hip. So when they have a rear end collision and they go back like this stops and the right shoulder always torques forward, and they can actually cause damage to the rotator cuff from a serious rear end collision. Side impact collisions will give them a contusion of the shoulder. They will many times hit their head, do a lot of spraining of the joints along with straining of the muscles. And so this is just a great all-around tool for acute injuries. It typically takes a few sessions to get things handled and allow the pain to come down, but it's a great therapy.
Yeah, that's amazing.
Yeah, it works so much better than traditional massage, to be honest with you. In 7 to 10 minutes or 8 to 10 minutes with this machine, we can work miracles that would take you 30 minutes with the manual therapy, and this will prevent as much soreness as a deep massage.
Yeah, that's great.
Cool.
Yeah, thank you.
Should we move on to the next one?
Let's move on to the next
Magic.
one.
You'll see a new piece of equipment.
I know.
Okay.
What is this device right here?
So this is the recently released M Vital by BTL. So this is my 9th laser. I've been utilizing laser technology for the past, 20 years. Wow. And I started out with something called a K laser. I at the time, it was a great laser. I went up to the next level of K laser. Then I had Erconia. I had a variety of lasers. My most powerful one that I had was a 60-watt Diawave, which was a great laser. Actually, it was designed by a specialist that worked with horses. He was a veterinarian. And they had it cleared for human use. They had a whole set of protocols, and it worked pretty good to a point. And so BTL, as I'm a clinical research center for them on doing some clinical trials, they said, we know that you've got some experience with lasers. We'd like you to try this new laser. I'm like, sure, why not? And I go, what's the wavelength? Because I'm hoping that they're going to say something, because I've been doing my research. And 1064 is the premier wavelength to really penetrate deep. And I've never had a 1064 laser because very few companies will spend the money to get to that level. BTL came out with the M Vital, which is a 1064 laser. I'm like, let's go. And then they said, this is a robotic laser. I'm like, what? And so this machine actually has a sensor here. You can use this machine with a handpiece like this, manually, like for a small region. But what's really cool about this machine is our ability to use the robotic sensor. The robotic sensor uses an ultrasound guided screen, and it actually reads the distance from the applicator head to the patient, and it has to be set within a certain set of parameters. And what it then does is it screens the area, and it just starts applying the laser as smooth as silk, and it's all done robotically. And if it ever gets out of range, it terminates or interrupts the therapy. Very safe. The patient also has an interrupt switch, but what we've seen is the tremendous difference of using a 1064 laser as opposed to the 980 and all the other frequencies that don't even hold a candle. And why? Here's the cool thing. 1064 penetrates deeper than any other frequency that I've had before. It can go almost 3 inches down. So that means on a herniated disc, I'm getting right there. I'm able to get to that surface depending on the body size of the patient, but I'm able to get in deep, and I'm able to not create so much heat because the fat tissue it's got so much water in it that it's going to absorb the energy of a lower level laser, and patients are going to say, "Ooh, it's nice and warm," but it's not doing anything. The therapeutic effect is limited on the other lasers, whereas this one is able to penetrate to a level, stimulate the mitochondria, and really get the healing jacked up on steroids for the most part. This laser has been amazing. I've never had anything like this. So we can put this on the neck region. We can put it on a shoulder. We can put it on any part of the body. We have special glasses for people. There's new and upcoming um, therapies that are going to be really crazy if they can pull it off, which I'm finding out about, and I can't really talk about it yet. But it's gonna make your hair stand on end. Let's put it that way.
For what this laser is going to be possibly
what this laser is going to be able to do.
That's amazing.
It's going to be tremendous. But
real fast, just like the laser, I got the body parts. Like, what would be good, once again, cases somebody comes in, what would be a good case for these things to heal somebody, or be like, why would somebody want to come in and receive this type of treatment?
Well, it doesn't hurt. It's quick, in about 10 to 15 minutes, you can get a great therapeutic effect, and it's immediate results. On our website, you can just see some of our patients, and I have testimonials. A lady with scoliosis who's had scoliosis for years and was recently considering surgery, and actually met me while I was doing a deposition because she was part of that, and she sought us out and asked if we had anything for scoliosis, and we said yes. And so she's given us a testimonial because she was part of our clinical trial utilizing this and M-Sculpt Neo. We did a combo clinical trial, and she said, "I'm not even considering surgery anymore." Wow. 12 years of suffering with scoliosis. So scoliosis, pain, just generalized pain. We're able to treat things that patients have had limited success with other therapies and other lasers. Just like chiropractic is not all the same, lasers are not all the same. This is a very advanced piece of machinery. It's very expensive because it's very effective. And that's what I've got to say about this. I'm super happy about this. When I get a piece of technology that works, I'm the biggest advocate, and I'll help other doctors understand the benefits of what these things can do. Because you know what? I've got laser PTSD, man. I've bought other lasers that just don't do what they said they would do, or the effects were not as long lasting. And now patients are, after the acute phase, they're able to go a month, 2 months without having that pain come back in, So this in no way can cure a torn labrum, but can they help the patient function better? Because I've got torn shoulders. I'm not ready for surgery. I can still do pull-ups. I can rip through some push-ups, and I can go through without having to have surgery. When you do the right exercises and you've got the right therapeutic equipment, it's all about the function. If you can function without pain, that's where it counts. So M-Vital is an amazing piece of equipment, and we're just, we were part of the clinical trial with this machine. We've only had it since October, and here we are finding amazing results. We can't wait. I want to work with more athletes, and so I'm looking for more athletic injuries to see how we can rehab that person and get them back on the field as quickly as possible, because time is money for athletes, especially professional athletes.
No, that's absolutely.
Yeah, it's cool.
That's really cool. Yeah, thank you for sharing that one.
Sure.
That's great.
Next.
Yeah, let's do the next one. So we have this really cool device. I've actually used this thing. I find it to be almost like magic for the brain. It's called ExoMind. I'm sure you can tell me a little bit about it.
Maybe.
Let's talk about what it actually is doing, and then it's also just like, what are the benefits? Like, what do people experience when they get this treatment?
Yeah, so ExoMind is something new from BTL. It's been out not quite a year, and for 40 years there's been a therapy called TMS, transcranial magnetic stimulation. It's been a proven therapy for depression and for serious clinical depression. ExoMind is a totally new machine which has been built on that platform, but using their patented waveform, because the traditional TMS waveform has been one that comes on and off like a light switch, whereas the ExoMind waveform is a gradual lift that goes for an extended period of time and then a gradual ramping down. What this means is that it's much more comfortable. And traditional TMS was extremely uncomfortable, and it takes up to 30 minutes or an hour to actually find the motor stimulus, which is the point at which the therapy would begin to be beneficial for the patient. And everybody has a different motor stimulus threshold. ExoMind threshold we can find in about 30 seconds.
That's remarkable.
Remarkable. So what's it for? It has settings to be used in a clinical for clinical depression, for ADHD, for medication-resistant depression. We like to use it for performance. Our patients are getting tremendous results at managing life. And what I mean by that is I have testimonials on the website. We have a medical director that oversees everything we do. And what we found is that many patients want to just improve the quality of their life naturally, without drugs, without invasive procedures. So in 30 minutes, a patient can come in and get a treatment. What does this do? It creates neuroplasticity. Neuroplasticity is the brain's ability to make good connections, to make new connections, to make fresh connections, to allow the neurotransmitters to facilitate movement with a better connection. How does that translate? It's like you think about your mind has got all this information, especially as we get older, we've got a tremendous amount of traffic. So ExoMind, in a very simplistic way, is as if you're on a 6-lane highway and all of a sudden 2 more lanes open up to the left and 2 more lanes open up to the right with the same amount of traffic. Now things can flow better. So we purchased these machines because we noticed that the quality of one's life can be improved, the quality of one's confidence, the ability to manage their emotions, so a much higher level of emotional regulation, a much better and controlled level of managing one's anxiety without drugs. And then the cool thing is it allows one's mind to perform at a high level. And what does that do? It gives you a better level of confidence. So I've had attorneys come in, try this machine, and they said, this is the best thing I've ever done. I've got 250 cases I'm managing, but I'm managing them. I'm not letting them manage me. I'm controlling the situation. Quality of my life is better. Your interpersonal relationships improve. It's been just a godsend for people. People that have been clinically depressed use ExoMind. People that want to improve the performance aspects of their brain activity. It improves sleep like something we've never seen. I've had patients, and we have testimonials where our patients have said, I've had the best night's sleep ever once they started this. Because we all have stuff going on, and it affects some of us more than others. So we're super excited about that. And we have 2 of those machines, one in Lehigh and one in Fort Myers, because we see that many people need the therapy.
That's incredible.
It's cool.
Yeah, it is.
It's cool.
It's a big one for me, and I'll just cap it off on that just by saying that my experience was one of curiosity. I'm all about being like, how can I improve myself, get maximum performance. I kind of went in there skeptical because I didn't know any of this stuff in the technology. But to your point, like my first night's sleep was incredible. And I sleep really well, but the fact that it was just even better, I didn't even know that it could be that much better, was just was amazing. And then the secondary thing was how I explained it to people is that the impulse control, my ability to make decisions that weren't in my best interest, I was able to have a gap where my brain wasn't like the 4-year-old child rushing towards the candy bar. Instead, I said, hey, this is my best interest right now. And I was able to say no and then make a better choice in my life. And that's one example there, but it trickled into everything. I wasn't getting overwhelmed when I would have the casework load or like my work in my business. And so I find this thing, I wouldn't believe it unless I tried it, and I tried it, and I'm a believer. And that's the part.
Cool.
It really is.
It's an amazing therapy, and my wife and I use it. And we got introduced to this when we were at a test facility, and we both tried it for 15 minutes. We both walked out of there going, what do you feel? Like you probably didn't feel anything different at the immediate moment, but then later in the day, you just felt like a chill, like you were calm. And that's where that emotional regulation kicks in, and you start going like, wow, like I'm not anxious about anything right now. This is really cool. And the deep level of sleep that you're able to achieve, to us, it was revolutionary. My wife, and she started tearing up. And as you can tell, we're probably an emotional couple, but she started tearing up and she said, honey, there are a lot of people that are suffering and our team needs to offer this to our community. So we bought one for each facility.
That's amazing.
And then we go from that to another amazing piece of equipment that we purchased that has, this is called M-Face, and it utilizes pulse waves that are there for a variety of things, because we have an aesthetics department in our clinic also. And so we have micro needling and a variety of different services that we provide, but this machine has an adaptation to help with temporomandibular function. So this is a new release that just came out, and we found great results with patients that have TMD, which is temporomandibular dysfunction, and it's almost always related to muscle imbalances, patients grinding their teeth, various positions, perhaps a trauma that they took, from a sports trauma or something like this. And so we're getting great results with this. And when we back this up with the laser, wow, mainly dentists are using this, but when we look for a musculoskeletal condition that is related to TMJ and such, we're able to do great therapies with the M-Face.
That's amazing.
Yeah, the TMJ function is really amazing. And we put that together with our other therapies. So as you can tell, we're highly involved with electrotherapies and with advanced magnetic therapies. Why? Because they work. They really do.
That's awesome.
And it's really cool.
Thank you.